Sorry we're starting a little bit late. As y'all know, the House schedule ran a little bit late, and there was a press conference that we needed to do, and so we're getting started. I want to thank y'all for your patience, particularly. Louis, can I get you to shut that door? It'll cut down on the noise just a little bit for us. So I want to start, first of all, by calling to order today's Appropriation Human Resources Subcommittee meeting. And I'm going to ask Chairman Mathiak to start us off with a word of prayer. I'm going to turn her light on.
Thank you, Chair Lady. If everybody will bow their heads. Thank you, dear Father, for this day that you've provided. And even amongst the chaos, that we will think clearly today and hear clearly each person that testifies before us. Thank you for each individual that's here to help us spend our dollars wisely here in the state of Georgia. Thank you for Chairman Dempsey and her dedication to DBHDD and her guidance for the rest of this committee. In Jesus' name, amen.
Okay, so we are going to jump right in. We're going to start off with behavioral health. Commissioner Tanner, the Department of Behavioral Health and Developmental Disabilities. If you could come. Oh, and first of all, too, I want to tell y'all. So y'all can move up. You don't have to stand up. Y'all, anybody that wants to come sit up here, you can. It looks like the whole committee is up here today. We may have a couple more wander in, but y'all are so welcome to sit in the desk, not stand up all day. And also, there is a sign-up sheet floating around. If anyone knows where it is, if you'd let me know. Anyone have the sign-up sheet? Okay. Let's, anyone who wants to make public comment afterwards, this is the sheet, and you are so welcome to sign that, either between speakers or whenever. And we will get to everyone as quickly as we can, but give you plenty of time. Okay. Commissioner Tanner, whenever you're ready, we're ready.
Thank you, Madam Chair. Appreciate the opportunity to be here. Thank you for what this committee does. If you are following along with your budget proposal, it'll be beginning on page 109. I want to thank the committee, specifically Chair Lady Dempsey, for all the work over the years on the topics we're going to be discussing today, and for all the work that you all continue to do. During my first two budget presentations, we talked about how we were utilizing all the dollars that had been allocated to us to continue to improve the lives of Georgians. We continue to take meaningful steps toward a stronger, more responsive system. Today I want to build on that conversation and talk about how DBHDD is strengthening the Georgia continuum of care. Before walking into the FY27 line items, I do want to highlight a couple of areas to you. First, supports and care setting for individuals served and waiting to be served through the Now and Comp waiver, and I know you'll be hearing from some individuals on that topic today. Second is our forensic services and our state hospital capacity. Both of those are top of mind, big issues for us and our agency, along with Georgians. I want to briefly talk a little bit about our planning list. You've heard me share this before, and those of you who have been on this committee know that we have around 7,900 individuals on what we call the planning list. One of the things that I have been frustrated with since coming into this role is I've not been able to clearly tell you how many people need a waiver now versus how many people may need a waiver 5 years or 7 years from now. Our team has done a great job in enrolling people into waiver services. In fact, this year we're on track to have the most people enrolled in a single year we've done before, which will be 1,000 new folks into waiver services. We have 400 to 500 people who roll off waiver services every year, typically on average for different reasons. So we replace those with new folks. And oftentimes the people who roll off are rolling off at a higher dollar amount. So along with the new waivers we get and the folks who roll off, we're able to add that many people back to waiver services. One of the things, and I just mentioned this about the clarity to how many people need a waiver. So one of the things I'm very proud of is Ron Wakefield, our team, working with the advocacy community, GCDD, others who have really, our provider network, our consumer network, have all worked collaboratively over the last 12 months to really take a deep dive into this issue. We've had both a work group work on this, and also you all passed some legislation that added an IDD subcommittee to the Behavioral Health Reform and Innovation Commission. And we've been fortunate to have Dr. Britton Laws from the University of Georgia chair that. She's nationally recognized in this space, and she's done a tremendous job. So I want to talk a little bit about some of the conclusions that they've come to along with the work group, and also just want to say this has been very much a collaborative effort between a lot of different organizations, not just a DBHDD-led issue. So the idea is to transform how we talk about the planning list. The focus shifts to real-world living conditions, loss of a caregiver, complex needs, unsafe or unstable housing, gaps in services. Our solution's a 3-tier system. The first one is immediate list. The immediate list is an individual who's going to need waiver services within this fiscal year. The second part's what we're going to call the planning list. Those are individuals who will need waiver services in the next 1 to 5 years. And then the last category is a forecasting list, and those are individuals who have likely needs 6+ years out. And a lot of times individuals fall into that category because maybe they're in school, they're receiving services through the Department of Education, but we know at some point out in the future they're going to need waiver services. So we're excited about where we're heading with that. We are in the process of having that tool validated through our university partner, and then start running everyone that's currently on the planning list through that new assessment tool. I also want to talk a little bit about some of our crisis and complex capacity within the state, specifically for the intellectual developmental disability population. We know that on a given day we have individuals, 15 to 25 individuals who get stuck in an emergency room, typically that are high needs, that we have a very difficult time finding placement for. I talk to providers all the time, and oftentimes these providers do not want to care for the most highest need individuals. So one of the steps that we've taken is opening the facility there in Macon, which is a 16-bed facility that currently has 8 of those beds open and occupied, ultimately getting up to the full 16 beds as staffing continues to increase. I'm also real excited that Mercer Medical School is operating the outpatient component, which opened in December, and it's been very successful so far. And they'll be able to provide services for people from all over Georgia, and they're training their new doctors through this program, and those folks will go and work all over the state. We also are expanding our crisis residential alternatives. These are community homes that are capable of taking care of higher need individuals. We have some beds open now. We anticipate having 20 total beds open over 5 settings by the end of the year. We currently have 2 CRA homes in Augusta. We have a third that's preparing to open in Macon, and we're under construction for 2 additional homes. So a lot of work going on in this space. Forensic capacity is the other big challenge. Last month I talked to you about some of the challenges our hospital is facing. I also told you that you all have probably gotten a phone call, 2 or 3, from sheriffs in your district complaining about someone in their jail. I just want to remind you that in fiscal year 2025 alone, Georgia courts issued more than 2,500 adult pretrial evaluation orders and nearly 1,400 juvenile orders. Nearly 70% of individuals waiting for pretrial evaluations are sitting in local jails. I will say we have really been able to knock down the wait list in this area. We were up to over 1,400 people waiting on an evaluation. That number is in the 400 range now. So we've been able to bring on some contract psychologists. We've been able to do some other things internally to bring those numbers down. It's actually 470 currently. Our IST rate is continuing to increase across Georgia. That is incompetent to stand trial. This means that individuals' mental health conditions prevent the case from moving forward. In FY23, about 38% of the people that our evaluators evaluated were found to be incompetent. In FY24, that number went to 40%. FY25, that number went to 42%. We currently have 800 plus individuals on the forensic wait list that are in jail waiting on a hospital bed. Now that number continues to fluctuate, just under 800 to over 800. On average, it's 413 days for males and 459 days for females. So that is a long time for someone to wait in jail, and that's why you're getting those calls from the sheriffs. Earlier, I mentioned we have 470 pretrial evaluations waiting. So if our incompetent rate is 42%, we can project that 200 of those will need restoration services. So that means if tomorrow I was able to do all the evaluations, we would have over 1,000 individuals waiting on a hospital bed. This places an unfair burden on our local jails, and it holds people in jail without receiving treatment oftentimes. So I've shared what's happening in local jails. Now I want to talk a little bit about our bed capacity. In 2023, we did a study that showed that we need at least 232 more forensic hospital beds. We know that number's now higher than that, but we haven't updated that study. We're projecting that we'll reach full capacity by the end of the year of 2034. What that means is individuals who are coming to the hospital who are not leaving the hospital because they're ordered there, not guilty by reason of insanity, etc., will outpace our ability to get people out of the hospital to the point that we'll have no hospital beds left in the state of Georgia. We've admitted 395 individuals in FY 2025. 69% of all forensic legal statuses are typically discharged with one year. Current data from FY 26 shows that 89% of ISTs are discharged within a year. We're proud of that. So we're a short-term care facility that's getting people better and getting them back into community. But where we really struggle is those individuals that are there not guilty by reason of insanity. And those are individuals who many times have committed extremely serious crimes. The courts determine that because of their mental illness, they're not guilty, and they order them to the hospital, and they stay there for a long time. Average length of stay is 8 years, so they're there with us. They're there for a long time. We have people there that's been there 27 plus years in our state hospital, so it's they're not going anywhere. So I want to talk a little bit about some of the solutions. You all funded, Representative Danny Mathis and Senator Larry Walker brought this idea to us a couple of years ago for a facility down in Dodge County. It was a DJJ facility. We took that over and restored it, and we are operating a program there that opened in January 2025. And just this 1 year, we've been able to have 73 individuals admitted. We've already discharged 45 of those. The average length of stay is 74 days to get someone restored. This is taking people directly out of jails into this jail-based setting. We run both the security piece and the clinical piece at this facility. And you know that in the amended budget, there were dollars available for a new standalone jail-based restoration facility at Augusta. The governor moved some funding around in this current fiscal year, and we're able to get that design done. We're getting close to being ready to move to construction. We should be able to open that facility in October of next year, which will add 40 additional beds to our system. Since I was appointed by Governor Kemp, I have made it my mission to convert underutilized hospital buildings into forensic beds. And over the past 2 years, we've added nearly 100 beds in our forensic space. I just want to give you a quick rundown of that. Savannah program, we have 30 beds. That's Operation New Hope, where we are taking those individuals who've been in the hospital for a long time that clinically we believe are ready to get out, but the court's reluctant. We move them into this program. Milledgeville has 17 of those beds we brought online. We have just recently opened, and we have 8 patients there at our Columbus program. We're going to have a ribbon cutting on February 25th. That's 30 additional beds. This is, again, just taking advantage of space we had and using the space. One individual that graduated from Operation New Hope program in Milledgeville had been in our state hospital system for 27 years. Another individual that graduated from our program at Savannah is now a manager at a local store there, doing really well out in the community. In 2025, Operation New Hope site served 43 individuals and discharged 5. And again, these are taking people out of our forensic beds and putting them into these programs, so we're able to backfill those beds with people coming out of jail. We also added some additional skilled nursing facility beds at our hospital in Atlanta. These are for individuals who are extremely ill that really need to be in a nursing home, but we cannot locate a private nursing home who are willing to take them, so we've opened those beds and moved those individuals there. So I think you'll see we have tried to get every inch of our facilities and take full advantage of every space we have. So I want to talk a little bit about a couple of things that I've already mentioned on the Jail Restoration Center at Augusta. That's in the amended 2026 budget, $20.7 million. That is, again, data is showing from our pilot at Dodge, we're able to use that facility and get folks restored quicker than anywhere else in the system. The other thing that I was listening this morning, I was happy to hear that The Senate has included $409 million for a 300-bed facility at our Atlanta hospital campus. That would be 300 beds that we would open up and use all of those beds for forensic patients, and that would be directly getting people out of county jails into the state hospital. So I want to walk through now, Madam Chair, the budget changes and the governor's budget. These first are statewide adjustments. I won't spend a lot of time on those. I obviously will answer any questions you have, but you've seen those in every budget, so I'll move on past that. At 15.1.3, so we're looking at addictive disease. This is replacing general funds with other funds for the expansion of hepatitis C screening services. This represents a replacement of state funds with McKinsey settlement funds. And then the adult addictive disease section, this was some one-time funds that was appropriated that's being removed from the budget. The next item, the $3.2 million, is to annualize 150 now COP waivers that you funded last year that have to be annualized. And then an additional $2.3 million for an additional 100 now COP waivers. Again, you all remember we do that for 6 months at a time, and you annualize that for the following years. So the total cost of all 100 waivers is just under $5 million, but only half of that's put in the budget. Adult developmental disabilities reduction to reflect an adjustment of the federal medical assistance percentage that just fluctuates on an annual basis and trued up and adjusted accordingly. This is the next item there is adult forensic services, $1.6 million. This is Operation New Hope at our hospital in Columbus, and this will be to annualize that funding for that hospital, that 30 beds that we just talked about that we're having the ribbon cutting on next week. That's already got 8 patients. Adult forensic services. Last year, we lost some money for our Cobb jail restoration facility. This restores $250,000 of that. We've been very successful in Cobb with this jail-based restoration program. It takes people from all over the state. Since we have opened that facility in the Cobb County Jail, we've taken people from 30 different counties, and we've admitted 82 people. Again, those folks are coming out of jail into a restoration program. And then the governor's also putting $2.3 million to increase funds for mobile crisis, RFP. Mobile Crisis is a very successful program. We're dispatching around 1,750 calls a month all around Georgia, but it had not been rebid in quite a long time, so the new bid showed the increased cost, so the governor's backfilling that increased cost based on DOAS's bid. Adult mental health, $2.9 million. This is for the 988 Lifeline. So we had some funding through the federal government that's going to go away. That grant's running out. This will be to keep that funding consistent so we don't lose any of our call takers. We received text and chat and calls into Georgia last year, 350,000 calls, texts, and chats, almost 1,000 per day coming into the 988 system. So this is a very valuable resource, and we don't want to lose any of our momentum. And then adult mental health, $9.3 million. This is to add 404 housing choice vouchers to achieve compliance with the termination of the behavioral health provisions of the settlement agreement that we talked about before. During the appropriations hearing, the joint hearing, if you remember, I announced that we had filed a joint motion with the Department of Justice to release us from all 60 provisions of the settlement agreement, and it would be replaced with one issue, which would be to get 404 new housing vouchers and another 137 or so other housing vouchers. I'm happy to say that last week on February the 11th, the federal judge signed that order, so we have officially been released from the behavioral health side of the settlement agreement. That's a 16-year milestone for our state. That has got a lot to do with the work that this committee and this House and the Senate has done over the past almost 2 decades. But this is a really big deal for our state and a big milestone, and we're thankful that the judge executed that order in a fairly quick manner. We're now laser focused on the IDD portion of the settlement agreement, which is the other side of it. And then the adult mental health side, this is a reduction again in the federal medical assistance percentage. The CNA mental health, this is $1.1 million. As you all know, we're building a new child and adolescent crisis facility in Savannah. We anticipate that's going to open this fall, and this will be to annualize the operating costs for that facility. So with that, Madam Chair, I know we're dealing with very complex issues. and all of them are expensive, complex issues, and I'm ready to answer any questions and or address anything else that I didn't cover.
Thank you. Thank you. That's great. And you know how grateful I am for the work that you and all who have worked beside you and before you and will in the future for the federal agreement and the execution of that very quickly. I know this has been a near impossible way to deliver the services that we would like to. So it's a new day. It's a new day in Georgia, and I hope we can figure out ways to creatively do much more. Are there any questions or comments from our committee members? If you would just maybe, let's see, we'll work on it. We'll adapt. Is that good?
All right. Thank you, Chairwoman. Okay. Commissioner Tanner, I was just really excited about the process that you guys put in place with the now-comp waivers and getting it down to 1217. And then you said that it was going to be confirmed by the university, that the process was, I guess, legitimate, and that it was followed all the standard operating procedures. Is that correct?
Yes, ma'am. So our team, along with advocacy community, provider community, worked to create an assessment tool, and that assessment tool will be validated. We're getting a couple of proposals from different university partners, and then once that's done, all 7,900 people will go through that assessment, and we'll be able to place them in one of those three categories. The number you're referencing, the 1217, so internally, our internal staff, our executive director, Ron Wakefield, along with his team, along with other members of the work group, work to try to come up with what they believe that number would look like, and that's where the 1,217 came from. So we're going to work to validate that as we move forward, but we believe that to be a close estimate.
Well, do you mind if I ask one more question?
Yes, ma'am.
To follow that up. So if we're waiting to get them in the tiers, and right now we do have a number from your experts, 1217, are you asking for those 1,200 comp waivers to be put in this budget? And then if so, how much will that cost?
Yeah, so obviously, the process for us as an agency is we have conversations with OPB in August, and then obviously the governor's office puts forward the governor's budget. So the governor's budget includes 100 new now comp waivers, and again, we'll have 400 to 500 typically on average roll-off services, so that'll free up dollars to enroll between 500 and 600 individuals. But obviously this committee in the past has taken that issue up and added additional waivers. But from my perspective, we're here just to talk. I'm specifically talking about what the governor's requested.
Thank you.
Yes, ma'am.
Do we have any other comments or questions from members of the committee? Not seeing any right now, but I've got a couple.
Good.
And
Yes,
maybe
ma'am.
that'll help them think of a few too as we go along. Could you update us on the status of HB 268, the school safety? I know that there were some things that you are required to do in there, and I hear you might be getting a lot done, actually.
Yes, ma'am. We have been working extensively on that. So we were required to do a couple of different things in that area. One of the things that we were required to do was to create a new job description for a student advocacy specialist, and that is somebody who could work in the school and to really be a navigator for mental health services. So we worked, our internal, Dr. Dole and our internal experts worked with external experts to create that job description, and are now working to create that training program that we will roll out in the near future. And I know we've had some conversations with Chairman Irwin, who's worked a lot on this issue, about funding needs and that type of thing. We're also looking at partnering with the Ralston Institute at Behavioral Health and Developmental Disabilities at the University of Georgia, and they'll be providing that certification and that training. So people who go through that program won't just be getting certified through our agency, they'll actually be getting certified through the University of Georgia. The other part that we were required under that law to carry out was to create a 2-hour behavioral health training that would be made available to all high needs elementary and middle schools. We have been able to complete that work, and we plan to roll that out for this upcoming school year. And also, we're going to be partnering with the Ralston Institute on that also. So they'll be providing that training in this upcoming summer for all employees of those schools. Hall County's also been a big partner in this. Some of you know Superintendent Will Schofield and his wife Joy, who's a licensed clinician. They have, as you know, there's 3 tiers of services in schools that we provide typically. First tier is all kids, talking to all of them about mental health, 988. Then you have the second tier, which is we've got a group of kids who are at risk that we're working with, maybe in a group setting. The highest level is when we have one of our Apex clinicians or somebody doing a one-on-one counseling service. Hall County's been able to reduce the need for that highest level by 40% by using this program they have in Hall County. So they've been a big partner in helping us, but we're going to be rolling that out this upcoming school year also. We also, under the bill, are required to work with GEMA to develop a plan for ongoing school safety plans. They're going to be required to submit, beginning January of next year, a part of their school safety plan has to be a behavioral health plan, and we have to review those and give them feedback. So we're working on that plan now, and we've also met with Chairman Irwin and the Speaker and talked about some funding needs that are going to be around that part of House Bill 268 in the upcoming year. So we're well on our way, and I just want to publicly thank Dr. Dole on our team, our director of our Child and Adolescent Division. She's really done yeoman's work in getting this all done in the manner that we were, in the time that we were given under House Bill 268. We're excited about that, and we look forward to continuing that work.
That's great news. That's great news. Thank you for the update.
Thank you.
Also, I want to know, in the amended budget, we added some funding for a rate study to address the staffing needs required to assist with complex and unfortunate cases. Do you know whether there exists an interim solution? Have there been some talks about that in your agency to help get these individuals the appropriate care they deserve today while the study is being conducted?
Yeah, so this goes back to those individuals who are the 15 to 25 people on average per day that are in an emergency room, medically ready to move out, but they're very high needs individuals that it's very difficult to find placement for. So the idea with the rate study is to be able to provide some dollars for sitters and other professionals to be in the hospital so that it doesn't tie up the emergency room staff. And I know that the Hospital Association has looked at what maybe some interim cost might be for that, and I believe they've estimated that to be around $2 million a year. Again, if that's something that we had funding for to fund, waiting for the rate study. But the hope is, and I believe we found in some other states that some other states have implemented something similar for the hospitals, because the 2 phone calls I most often get as the commissioner is sheriffs calling about someone stuck in their jail, and emergency room and hospital CEOs calling about someone stuck in the hospital. And so those are the 2 things that we are working to try to find solutions for.
That's great. Thank you. Chairman Mathiak, I think, has a question.
I'm going to use this one. Okay. Trying to figure it out. Thank you, Commissioner, and thank you, Chair Lady. With the governor recognizing our homeless situation, what can you give me an idea of how the department's going to serve the homeless folks, and what will that look like, and what's the plan there?
Yeah, so we have several programs that attempt to address maybe some of the causes of homelessness. Our community service boards throughout the state are working to try to provide mental health services in the community with the hope of preventing someone from getting to that stage. We also have 22 teams that are what we call ACT teams. That's assertive community treatment teams statewide that are currently serving 1,390 individuals. then that is a very, it's almost like a hospital on wheels where we take services to the person. So instead of having to bring the person to the hospital, we're able to take services. That includes psychiatry, nursing, social work, substance abuse, vocational rehab, certified peer specialist, the whole 9 yards. We also have a program we call SOAR, S-O-A-R, that assists individuals who are homeless, also with SSI, disability applications. It helps get those individuals services that may be able to help them get housing. We also have what we call PATH teams, and those are street teams, street outreach teams that engage individuals who are homeless with serious mental illness. We have 9 of those teams that you all have funded that are working statewide, and we've got a 75-25 federal state. SAMHSA funds 75%, the state funds 25%. We have 4 of those teams in Atlanta. We have others in Athens, Augusta, Savannah, Valdosta, and Columbus. And typically, we try to serve an individual for about 120 days with one of those teams. We try to also figure out what are the barriers to getting someone into services. One of the things we found was it was taking a long time to get someone a birth certificate. So we embedded a DBHCD employee at the Department of Public Health, and we've changed that where it takes about 24 hours now to get a birth certificate. The other thing that you all have funded significantly is the Georgia Housing Voucher, and there's 404 more of those vouchers in the budget, and those are vouchers for serious persistent mental illness that for someone who's homeless, unhoused, that we can get them into housing. The thing I'll say about that, it's not just housing, but it's also wraparound services that get provided, so they get provided other services to hopefully help keep them housed. So we have a lot of programs. Obviously, one of the challenges sometimes if someone is severe with their illness, they may need a hospitalization, and we just don't have the hospital capacity. So that is a real gap in our service delivery, and one that hopefully we'll be able to fill in the near future. Thank you.
Thank you. If you would raise your hand if you have a question, just because our microphone. Okay, Representative Donahue.
Thank you. Commissioner, let me ask you a question back on your page, forensic capacity challenges. What is basically, since I've been on the committee, I notice it's more and more and more, what is the number one driving process for this continuously growing as much as it's growing? I mean, is it a new mental health rules that we came out with? What criteria?
Yeah, no, I don't think it's that. I think around the country, most states, lots of states have added hospitals. States have built multiple new hospitals in the last few years. Georgia's gone from, in 1970, we had 4.5 million people. The last new hospitals we built were in the 1960s. So you're talking about, 70 years ago, and we've closed hospitals since then. So we have less bed capacity now than we had in the 1960s, but we have over 11 million Georgians. So I think part of it is just a certain percentage of the population nationally have serious persistent mental illness, and with 11 million Georgians, we're going to have a certain percentage of that. The other thing I'll say is the courts have also started recognizing when someone is not competent to participate in their defense. Families are more willing, and stigma has gone away, so families are more willing to say, hey, my loved one needs mental health services, my loved one needs to be checked. So we're getting more orders to do evaluations, so we're getting more people in the system that way. But we're seeing this nationally. The other thing we see is the acuity level is higher. And there's a lot of studies that are coming out around this and why maybe there's a higher prevalence of mental illness, and there's a lot of theories around that. I'm not really able to tell you exactly why maybe we're having, but I can tell you population and the number of orders we're getting from the court. The people that are waiting on a bed are not someone that a doctor or it's a court order telling us that we got to take the person.
Let me ask you, looking back, and I've had the privilege of touring several times Milledgeville.
Yeah.
Great facility for what we need. However, it's there, what are we doing with it, or what would the cost be to bring that back or something similar to where we would already have the capacity to add to, instead of every year we're like, we need more, we need more, we need more. And I was asked today by two people as chairman was delivering a bill. They walked up to me and said, wow, wouldn't millage bill be a useful product for certain things? And I said, you know, I really don't know. So I told them I would ask you that question.
No, that's a good question. And I've toured all the facilities at Milledgeville. The buildings that are there now that are not being used, because we still have a hospital at Milledgeville and we still have patients there. The buildings that are not being used are so dilapidated, and we'd have to build new there. And we have land. The challenge at Milledgeville, though, if you built a new hospital there, is staffing. Very difficult to get doctors specifically to go to Milledgeville. That's why, because I've been asked by some leadership, we build a new hospital, why don't we build it, in this place or that place? We have a hospital out on Panthersville Road here in Atlanta, and we have a big grassy area that's perfect for a new 300-bed facility. We can staff it here, and that's the challenge. Here in Augusta is the two places we can staff a new hospital. Be very difficult to do it somewhere else. So it would have been great, hindsight's 2020, if a lot of those buildings had been maintained. They just haven't been maintained, and most of them are not usable.
Right, and thank you. I figured that. I just remember touring. I think you could feed thousands and thousands of people. Mm-hmm. It was really designed well. Yeah. And when we were looking at it on state properties, it was like everyone was pretty impressed with what it did at the time. Mm-hmm. And I just know you're right. We have to go forward, or we're going to be with this same dilemma every year, to where we go ahead and build it because they're coming. Yeah. And when I say they're coming, we want to make sure we're prepared for whatever.
Right. That's
Thank
right.
you.
Yes, sir. Thank you.
Thank you. Are there any other questions or comments from our committee? Representative Cameron, I know you're way down there, but if you need to say anything, you let us know. Okay. I want you to be here with us.
I can tell you, I don't want to speak for him, but I can tell you I hear a lot from his constituents that they'll be excited if we're able to build a new hospital.
That's right.
Yeah.
That's right. That's great.
Thank
you so much. Not seeing any other questions.
Thank you,
We'll
Madam.
be in touch if we need any as we begin the budget process, but appreciate you and everyone that's here with you.
Yeah, I just want to give a quick shout out to my finance team, my operations team. They do a great job, Madam Chair, to make me look good, and we got a lot of good folks doing a lot of good work, so thank you.
Thank you. Thank you. So those of you that are standing, I want you to remember that you can move up and sit if anyone wants to, if you're more comfortable at any of these desks. It will be fine today to sit in our desks as well. And next we will hear from Commissioner Ross, the Department of Veteran Services.
Good afternoon. Thank you to this wonderful committee for having me here today. It is always an honor and a pleasure to brief y'all. So we're going to cover the 27 budget. The first part is going to go fairly quickly, and then we're going to talk about the issues that I think are most important to you and to Georgia's veterans. You'll start on page 10 of your tracker. So as usual, Veteran Service, we're at the very end. But you can see starting section 48 at 48.1, Departmental Administration. We have all of the statewide adjustments, whether that's for technology, insurance, the benefit plan, or the Georgia at Work system. So in the interest of time, I'm not going to cover the statewide adjustments because that's throughout our 4 programs. But just so you know, for our administrative program, we do concur with the governor's recommended budget. Moving on to our cemeteries program, as you recall from our amended FY26 budget brief, we were notified by the VA that we had the opportunity for a cemetery in Augusta finally. So that was well after the budget cycle had started. We weren't able to get any request in, and we're on a short timeline. So you can see that we have added a request for an Augusta cemetery director. This would be somebody ideally we would hire in July. That gives them 3 months to not only get trained by the VA, but to shadow our cemetery directors in Milledgeville and in Glenville. as well as then taking the lead with Georgia State Financing and Investment Commission on actually building the cemetery itself. And so that is our one request, and that's only because we did not have time to get it in the budget. But otherwise, we concur with the governor's recommendation. Looking at our benefits program, I skipped nursing homes. Looking at our nursing home program, again, those are our statewide adjustments. We did have the one non-statewide adjustment, that add on the last line to increase funds to match federal funds for our existing bed count. That will keep us at 185 funded beds. So we appreciate the governor putting that in the budget. As you may recall from previous years, on average, about 5%. This last year was 3%. We have a consumer price index. The VA increases every October, and we have to match that. So this funding will allow us to keep the same amount of beds that we have currently. Now going to benefits. We also concur with the governor's recommendation, and I do want to say how much we appreciate the increase of funds for our operations, field operations, and appeals officers. Last year, Human Resources Agency did a study and adjusted the baseline salary for these highly technical and legally specialized folks. And so what was provided in the governor's recommended budget was about half of what we asked, but will get everybody up to that minimum salary wage. And so we appreciate those folks now being at the minimum wage based on their job code. We also ended up getting one position for Savannah Tech. We do have a need to grow the number of veteran service officers in the Savannah area because of their dense veteran population. And so this is to support a person in the new Savannah Vector Center. So the one thing that's not on here, because it was not in the amended budget, and of course we saw that this morning, was our closed loop referral system. We needed an additional $864,802 to fully fund that contract this next year. So I just wanted to highlight, because that was a late change as of this morning. And so when you go to the summary that shows what the governor recommended, and then this includes the $102,000, that salary plus fringe for an Augusta cemetery director. That is why the bottom section in green is what we are requesting as an agency net. Now that does not include the delta for the closed loop referral system at just over $860,000. So now shifting to something I think everybody is interested in. Again, this can be funded however the state and the Appropriations Committee deems is best appropriate, but I did get this question after our amended FY26 brief, whether this could be a capital project. It absolutely can be. So just to kind of go back in time, in 2022, we actually were asked to provide research, and it was a Senate subcommittee led by Senator Kay Kirkpatrick on the need for new veteran homes. We contracted out with the Advancement for Military and Emergency Services Research Center from Kennesaw State to determine the need for the new veteran homes and where they should be located. What they determined in that study and the Senate subcommittee recommended was we start in South and North Georgia because there seemed to be a greater need based on the economics of the veterans living in both those regions of the state as well as education level. And so what we would like to do is, through the incredible support by the Albany community, as you've heard, we'd like to request one-time funding. That is $35 million in state funds, which would be matched in federal construction funds by the VA of $65,000. We do have a couple of timelines we have to meet. We have to submit our grant application by the 15th of April and have to have those funds available no later than the 1st of October of 2026. Just so you know, I've gotten questions, why in the world did we choose Albany? And you'll see this in a minute. But not only did they fit the criteria of being in South Georgia, they're a medical hub with Phoebe Putney. They have Albany Tech through their Live Learn program, as you heard, finding staffing, especially in Milledgeville, as was just discussed by Commissioner Tanner. is a challenge, but the Live Learn facility in Albany, which actually produces nurses through Albany Tech and then also Albany State, they have committed to helping us with any sort of nursing staffing needs. And so that's critical as far as wherever we would place a new home. You also have about 20,000 veterans there within that 50-mile radius of Albany, to include about 1,000 Marines. So it's our only facility, if we were to build a new home, that will be close to an active duty military installation. And I should point out, we've never had a new state veterans homes. We have always been given pre-existing facility to include part of Central State Hospital in Milledgeville. And so we're requesting for the first time a new home. And I'm going to go into a lot more detail. So this is our Milledgeville capacity. I've been asked a lot of questions as to why we just don't fund more beds in Milledgeville. Augusta at the moment is at capacity, so Milledgeville is the only place we have beds. Currently, the numbers have gone up. Milledgeville can accept 16 more patients based on state funding, as we are funded again for 185 veterans. But we do have requirements to renovate existing facilities. So if we spend the funds to renovate the Wood building, we would actually decrease the number of beds, leaving us space for 99 in that facility versus 117. Residents right now complain about cramped quarters, congregate baths, the lack of individual rooms. And because of that, while Wood is partially renovated, I would recommend renovating the Wood building. The Vincent building, which once you got it ADA compliant, would go from 48 to 36 rooms. I would not necessarily recommend renovating that, and I'll show you in a minute. So we need to renovate buildings, the first of which was built in 1902. The most recent was about 50 years ago. And we also have to move away from that barracks style to single rooms in a home-like environment. That is what the skilled nursing home, that's their model, as well as the model from the VA. And just so you know, this is something that, of course, I deal with on a daily basis, but Georgia would move to the top of the priority list. There's only 2 states who have a greater need for veteran homes, and that's Texas and Florida. They are both currently undergoing the building of new veteran homes, and we know that this year they will not be submitting an application. So we would go to the top of the list. And I will tell you, the VA has called me on numerous occasions asking why we have not requested funding for a new veteran home through their grant process. So they're taking a look at this as well. Just to show you graphically, both homes actually need renovating. The reason why I didn't recommend renovating the Vincent building is it would cost almost $7 million, and we'd go from 48 beds to 36 beds. That would make them ADA compliant, single room beds. Quite honestly, I don't believe that that's the best way to spend taxpayers' money. That's a significant cost. Now, we do have a partial renovation, and so that's about $3.5 million to finish renovating that facility. That was in our priority list. We have it in FY28 as part of our COB submission. On the other hand, most people ask about Augusta. Well, Augusta, quite honestly, would take $34 million to renovate, mainly because of lighting, but mainly because of asbestos abatement. It's filled with asbestos. So for the same price we would build a new home, we could renovate Augusta. And currently I don't have any space through Georgia Properties to be able to do a home in Augusta. And we'd also have to have a new facility to move all of the patients because I can't displace them. So that's kind of where we sit from a renovation perspective. When you do a cost comparison, so being good stewards, again, of our taxpayers' funding, we would need just over $45 million to renovate existing facilities. That would only gain us 47 beds above what we're currently funded for. Again, 47 beds. And if you just do the renovations on the facility, again, dropping out the Vincent building and just completing the Wood building, we actually only increase 11 beds over what we're currently funded for. Where a new facility would provide 120 beds, and the state would not have the enduring operational costs, nor that CPI match to the VA year over year that compounds, and would be operated via a revenue sharing model with a contractor. So our older facilities, quite simply, will never generate enough revenue to cover costs, which is why we do have the state funding as part of that per patient per day cost, just because they're old physical plants. I think Representative Donahue, we talked about the Milledgeville facility, that is us. It's an old physical plant, and it's just very difficult to keep up. So looking at it just slightly different in one big picture, you get the $45 million just over in total renovation costs, but you do have that reoccurring and compounding operational costs that increases year over year. This last year was at 3%. Net gain, if you don't renovate anything, is only 47 beds. So why are we asking for the one-time investment? Mainly because we believe this is the best model financially for Georgia and for Georgia's veterans. One-time construction funding with some initial cost once the facility is complete, but no enduring cost. It will be self-sustaining. In a revenue-sharing model, the home would make money, and based on us benchmarking this model with several other states, over time, this would provide us funding to then seed the state portion of construction of other new state veteran homes, as well as potentially covering operational and capital projects without having to come back to you every year asking for more funding. It provides modern and ADA compliant single rooms for our nation's heroes in keeping with state veteran home standards, which are provided to us by the VA. It also allows care to be more geographically dispersed in an area where the socioeconomic need is the greatest. So looking at the cost over time, just to show you, in less than 5 years, the state will spend more on just adding 120 veterans to existing facilities, and that's with us putting multiple people per room, right? We've got 2 people per room now. That's going back to the 3 people or the 4 people per room to add 120 veterans without taking into account any renovation costs. So in 5 years, less than 5 years, we will have already spent that $35 million. If we renovate and add the 47 beds, it'll be around 8 years to match that one-time investment of $35 million. So in the first case, the state would spend more than $47 million above the initial construction cost of a new facility, so we could conceivably build 2 homes during that time. While with the renovated model, within 10 years, the state would spend over $8 million more than the $35 million in construction costs. So that's above that $35 million is what you see on that slide. So to reiterate from last year, and I know you saw this, Georgia is behind the number of homes compared to surrounding states, as well as the number of beds. Many, such as Alabama and South Carolina, have half our population, but more than double the number of beds and homes. And the time to make the investment is now, where 50% of Georgia veterans are over the age of 65. They have more complex needs due to decades of war. And even if we renovated and added the maximum number of patients to Milledgeville, again, with multiple patients per room, we would still be about 1,500 beds short of what the VA would fund, and they say we as a state needs. Therefore, we are requesting one-time funding of the $35 million in fiscal year 27, which could be via bonds. And again, the first home ever established, new home ever established in the state of Georgia. So this slide is a new one. We came up with this one earlier this week. We plotted where the residents in our Augusta home, which is yellow, and in white are where our residents in Milledgeville are coming from. And you can see the star kind of in southwest Georgia is Albany. There is a big gap of where our patients are coming from. That area of the state is not being served by either of our 2 veteran homes. You also see up in North Georgia, again, where that study said there needed to be another state veterans home. So both have large veteran population, and so we would meet with this very first home, that demand in that southwest Georgia region with a home in Albany. But I thought this was pretty informative once we plotted where the patients actually are coming from. So what it would look like just north of Phoebe Putney, that is the land that the city of Albany has agreed to provide to us. This is a rendering, whoops, it's going too fast, a rendering of the actual 120-bed home. We are using a model that right now is being constructed in Florida. It fits perfectly on the acreage that the city of Albany and Dougherty County is providing just for a state veterans home. Just to show you again, these were the beds I showed you during the amended brief. This is what they currently look like. 2 patients per bed, again separated by curtains, barrack style and congregate baths. This is from the same architect that we are working with now on the Albany facility and the design. This was a facility opened in Idaho, completed back in 2022 and is now filled. It's at 98% capacity. Those are your single person rooms. And then when you go to the next slide, you can see what the common areas are. So a one-time investment in a modern state veterans homes delivers significantly greater bed capacity, sustained federal VA cost sharing, CPI resilient long-term operating stability, and broader geographic access for Georgia's veterans. It's not only better for our taxpayers, but in an environment like the one we show you here, in the last 2 slides, it's what I believe we owe our veterans, and it's actually what is provided by every other state. So I know that's a lot, but I look forward to hearing your questions.
Thank you for the good work you're doing. Chairman Williams.
Yes, ma'am. Oh, excuse me. Yes, ma'am. Thank you. Albany is real close to my district, but I just want you to know if Albany fails or falls through, you could go 40 miles east to Cordele. We're on I-75.
You are.
We have Georgia Veterans State Park. We have the lake. We have Georgia Highway 300, and our land is much cheaper, and our help is much better. Plus, we have a first-rate hospital, and your representative would be a lot better. So.
Well, thank you.
Thank
I've
you.
already jotted down Cordele. I go through there frequently. Thank you, sir.
I believe I saw her making notes on that one, actually. Yes, okay. Representative Cameron, let's see if you can use that.
Use Emory.
Can you use Emory? Great.
Hi, good afternoon. Do you think you're going to get better health outcomes, better results with a newer facility, and better, just overall, a better experience for the veterans?
Since we've never had a new facility, while I don't have quantitative data, I would tell you qualitatively, absolutely. If you look at just the 2 different environments, if somebody is going to lodge a complaint on care, they're both going to be receiving world-class care by whomever we bring on as staff. But if you're in a facility where you're bickering with your roommate and you're separated by a curtain and you're having to go down the hall to a congregate bath, and it's like you were going through basic training again, versus having a private room with a private bath, automatically you're going to feel like you're getting a higher quality of care. Your family is going to feel like you've got a higher level of care. It's just, they're beautiful. I've been to several throughout our fellow states, and they're gorgeous facilities.
And they won't be arguing over Judge Judy or a ball game, that kind of thing. And when you talk about North Georgia, I live in North Georgia, but are you talking about like north of here as being North Georgia? Or?
Yes, sir.
Okay.
The report actually said Dahlonega would be a good place. We've been working with state properties since that report was published to try and find actual land that could be given to the state. Albany is the first one that came forward with land in the area in South Georgia where we needed it. I've had a couple of conversations with folks in North Georgia, but that would be what would be required.
All right.
Land
Thank you,
to be
Commissioner.
given to the state. You're welcome. Thank you, Representative Cameron. So I've got North Georgia already on there. Cordele. Anybody
Don't
else?
forget Rome, okay?
Of
While
course,
you're
Rome. I
looking
can
at
say
North
Rome.
Georgia, let's
Rome
not
is
forget
part
that
of our
one either.
North Georgia.
That's
We
right.
could go to Rome.
Okay. Chairman Mathiak.
Getting for a 2-person room, not a 4-person room.
Well,
correct?
2-person room is what we have now. After COVID, we did take them down. They're small rooms, and having 4 people, honestly, to me was not safe, of course, in the pandemic environment, and honestly not the best way to treat our veterans. So we do have 2 people per room now. What we really need to go to in a new home is single-person rooms.
I like
That would resolve a lot of our residents' complaints.
I like that. Thank you. Thank
You're
you.
welcome.
Representative Glade.
Thank you, Chairwoman. I wanted to ask if you could share a little bit more of how Albany State is going to be able to support the proposed new state home, the Albany State University.
Staffing, yes, ma'am.
Okay.
So both Albany Tech and Albany State have agreed. I've met with that entire group that said they would be more than happy to help us with nursing staff. Again, and Phoebe Putney also said that they would assist as well. So staffing, as was already heard with DBHDD, is always a challenge, especially when you get in a rural area. We have that challenge in Milledgeville, and that's why we look for a location where we have tremendous technical college and university partners who can help produce that staff.
Well, we're excited to hear that both of them will be able to support, and that way we have land and we have staff.
Yes, ma'am?
Okay, are there any other questions or comments from our members? Not seeing, I have one. So this morning,
Yes, ma'am.
we briefly saw that the Senate added about $15 million to your amended FY26 budget to eliminate veteran homelessness. I wondered if y'all have any plan. I know we all want to eliminate veteran homelessness. There's no doubt about that.
We do. We're working on some proposals now. I will tell you, my phone was a flurry of phone calls. I've got some meetings after this as well to discuss the plan. Veteran homelessness, I think I shared last time, about 20% of our homeless population are veterans. And veteran and homeless should never be in the same sentence. So the last point in time count was just over 416 homeless veterans. And that's only a one-day count, right, where we know where our veterans are, and we know there's far more here within the state of Georgia. So we're working to try and come up with a comprehensive plan to help solve that throughout the state, not just focused, here in the metro area, but we know, in fact, we're working with United Military Care for our next We Care Fair in Rome to actually have a separate day just for homeless veterans. And so we've got some big plans, so we'll see what happens with the budget.
That's wonderful. Well, yes, I think we may have another question down here. Representative Donahue?
So with our ex-leader here, Doug Collins, who is a good friend, is everything easier now in the process when you need something? Can you reach out to him?
So we've got a great relationship with him and his team. I will tell you, I shared this before. The reason why there was so much funding in the National Cemetery Administrative budget, more so than historical funding levels, more so than ever, 10 times what we normally see, is it got down to priority 30 for the Augusta Cemetery, which just so happened to be ours in his home state. So I do think that had a lot to do with it. But yes, I do believe we will get tremendous support out of Secretary Collins and the VA team.
And thank you. And of course, the promised land is up in northeast Georgia, where we could probably still dig for a little gold.
Then maybe we can fund this a little easier.
Okay, that's great. I don't see any other questions or comments at this time. Thank you for the work you do every
Yes.
day. And if we come up with further questions, we'll be in touch.
I appreciate that. And as always, thank you all so much for your support. I always enjoy speaking to you, and thank you for all that you are doing on behalf of the state.
Thank you. Next, we will hear from Tracy Alvord with the Sexual Offender Risk Review Board.
Good afternoon, Madam Chair and committee members. Thank you for your time. I really appreciate it. As you can see, there's one change which is statewide for SORB, and so I'm really just excited about giving you an update on how we are doing with the funds that you have provided us for the last 2 years, and hopefully we'll continue that. So in FY24, which was prior to getting the significant change in our budget, you can see we had 3 part-time investigators and 4 full-time clinical evaluators. The investigators are important because they collect all of our criminal documentation regarding a sex offender's criminal history. So we don't just collect their sex offense, we collect anything related to risk. So any kind of violent offense, anything that could potentially be sexual in nature, probation violations, that type of thing. And then our clinical evaluators have to summarize all the relevant information that suggests risk. So in FY25, we went up to the 8 part-time investigators, 13 full-time clinical evaluators, and 9 part-time clinical evaluators. So a huge jump, and so you'll see the numbers jump significantly with the completion of classifications. We did find difficulty in keeping part-time folks and getting them trained effectively, and so I merged some of those positions into full-time positions, which has worked out much better for us. So with the a couple things that were really our primary focus right now is obviously the backlog, as well as identifying immediately sex offenders that have 2 separate sex offenses in their criminal history, so we can address them as quickly as possible because we want them to be monitored as highly as possible. And so with the investigation statistics, just to kind of give you an idea, in FY24 they completed 1,616 cases that year. And then this year, we're projected at 108,050 cases. And they'll pretty much stay around that same amount just because of the number of investigators that we have. But with that, back in FY24, we weren't focusing because we didn't have the staff for the immediate priority cases and what that means, 2 separate sex offenses. Now that we focus on that, our investigators have to spend a whole lot more time gathering documentation. So if you can imagine, if we have individuals, and you'll see a criminal history where they have 4 separate sex offenses and some from different states, it takes a lot of time to collect that information. So it does just kind of reduce the numbers, but it's still really good. So our evaluations, which has shown a substantial increase, we had 516 cases completed in FY24, and we're projected to have 1,180 for this fiscal period, which is a big deal too, because at the same rate, initially back in FY24, we were not focused necessarily on those cases that we knew to be high risk because we didn't have the staff. Now we have staff, we are focusing on those, and so an individual who has multiple sex offenses, there's a whole lot more documentation for them to review. And so, but we continue to climb that number, and I anticipate next year to be even more, so it's been a really good experience with that. So with our backlog, so it doesn't look like a huge number. So we go from 4,421 Georgia backlog down to 4,291, so that seems really minimal. However, if we were to go back in the years to look, we weren't getting any of the backlog taken care of, and as a matter of fact, the numbers were increasing in the backlog. So we get anywhere between, I would say, 100 to 200 new sex offenders every single month. Whether it's newly convicted, coming in from another state, or being released from prison. So in the past, all those were going into the backlog because we couldn't even keep up with what the cases were new. So now, we're not only addressing every single new case, we're starting to dip into the backlog, which has never been done before. So we're really excited about that. So again, immediate priority cases are cases where a sex offender is identified in his criminal history to have 2 separate sex offenses, and they're not necessarily convicted of a second sex offense, but it's been dismissed or maybe acquitted or convicted. But we've really been trying to spend time on those because we want to make sure the sheriff's departments, police departments, Department of Community Supervision, pardons and parole can really monitor these individuals as effectively as possible because we know that they're especially dangerous. And so in 24, we were able to, in investigations, we identified 173 of those cases, and out of those cases, then the evaluations for that time, we had, the number of cases that we had, we came up with 119 sexually dangerous predators in the completion of cases for the evaluations. Now in 2026, the investigators have identified 88% more cases just in FY25, from 24 to 25, and then 39% more this year coming. And with the evaluations, we've gone from 119 SDB cases to 374 projected SDB cases. Doesn't mean that there's more predators in our system necessarily. It's just that we're identifying them more quickly, which is, I think, really important. I want to just kind of give you a picture of what different cases are. So we title our cases in different ways, but there's 3 primary ways we title them. We identify one offense cases. So if you go down and you look at the criminal history where it shows one offense from the July 13, 2017, he has an obscene internet contact with a child. That is an individual that is the only thing in his criminal history. We try to identify those quickly because we believe that we can process them more quickly because it's one offense and that's all we have to investigate. What I want to point out in this case, with this particular offender that I pulled this criminal history from, he's a predator. So it's a good indicator that looks can be really deceiving. Typically, in cases like this individual probably had multiple victims as well as some problematic other behavior. But in the FY25, one offense cases we identified was 206 of those cases with just a one offense like this guy showed, and 14% of those were predators. And then in a standard case, which is the next one over, you see he has a huge criminal history, lots of probation violations. He has the one sex offense, which is child molestation. We also have some violent offenses, probation violations that we have to review, but this is kind of a standard case, and he has one sex offense but other types of criminal behavior. This guy was also a predator, just as an example. And out of standard cases in 25, 18% of those end up being predators. I'm going to just jump really quick to show you our two immediate priority cases. So these are examples of immediate priorities. The first one you see where he has numerous sex offenses from Pennsylvania and Georgia. This is an obvious, easy case in the eye of just knowing he's a predator without needing a whole lot more information, but we have to summarize all that information. The second case is where we identify as immediate priority 2. So he has a prior sex offense that he got dismissed, and then 20 years later, he committed another rape that he was convicted of. We would identify him immediately and then process that case immediately, classify him immediately, so if he's on probation still, he'd have a monitor on his ankle, but also being observed by law enforcement. So out of the IP cases that we identified, 78% are predators. So we know they're more likely to be high risk, and we really want to focus on those cases. So the last thing I do want to share is that in the age of AI up and coming, we're really, really excited. And we've been talking with GTA, and hopefully we'll be able to be a part of that because it can be really helpful and beneficial in summarizing information for us. And it would significantly cut down on the time it will take to do a classification, and that's our hopes for the future. So I'm open to any questions that y'all might have.
Thank you for your update. Are there any questions or comments from the committee? Any? Got one? Okay. Representative Donahue.
Thank you very much. You know, predators is sad, basically, that we talk about stuff like this and it increases more and more. How many, just since we're on this subject quite a bit, are illegal that's here in the country versus people that have been known predators, and what percentage in the last 5 years has it increased?
That is a really good question and something that we've been looking at. So we had our database adjusted to start identifying those who are here illegally and are being deported, and those are not deported. And we just started that process, so I don't have those numbers for you, but I hope to have them next year because that's very interesting to me as well.
Thank you.
You're welcome.
Any others from anyone? Looking up and down.
Thank you very much.
You did a great presentation. Let me ask you one thing, though. So looking ahead, what resources do you feel you need to, in the future, to completely eliminate the backlog?
So I think I'll have a better idea for you once, and hopefully we get involved with AI. If that happens, I anticipate it being a huge adjustment to our backlog. And I think, and we're hoping to have that in this fiscal period taken care of with GTA. And so the next year, I hope to give you a really good perspective on that.
So maybe when we come back and look at the 27 amended, possibly you might have some numbers for us at that time. That's great. Well, thank you so much.
Okay,
Appreciate
thank you
it.
very much.
Okay, next we will hear from the Georgia Council on Developmental Disabilities, Rena Harris.
I'm a little petite. Good afternoon, everyone. I'm Jessica Cowell, the Public Policy Chair for the GCDD. I'm here with Rena Harris, our Chief Program Officer. The mission of the GCD, of the Georgia Council on Developmental Disabilities, is to bring about social and policy changes that promote opportunities for the wide spectrum of people with developmental disabilities and their families to live, learn, lead, work, and play, and worship within their communities. The GCDD is an independent state agency. It's administratively attached to the BHDE. It is governed by a council of members. Over 60% of those members are individuals with developmental disabilities or a family member thereof. I will let Rena take over the next portion.
Thank you, Jessica. I want to, we want to thank the subcommittee for the opportunity to present the state fiscal year 27 budget. I would also like to point out that the photo is one of our newest members, Lynn Ashcroft, being appointed by Governor Kemp with her daughter applauding. The bulk of GCDD's funds are federal, a bit over 70%. But today we'll be discussing our state funding. And, okay. The slide that you're seeing represents page 3 of your tracking sheet, I believe. The only thing here in terms of changes to the Georgia Council on Developmental Disabilities budget is the standard reduction in employer contribution to the state health benefit plan that you're seeing across agencies. So in looking at our state funds, $816,436, almost all the state funds as per legislative intent are for inclusive post-secondary education, or IPSE for short. Inclusive post-secondary education, or IPSE programs, give students with intellectual disabilities the chance to attend college with their peers who may or may not have a disability. Of those IPSE funds, $600,000 flowed directly through us to these 10 programs and the consortium that supports the IPSE programs. Georgia Southern and East Georgia State recently merged. We're listing them separately here because they're continuing to offer 2 different IPSE programs, one on each campus. And we want to thank you, members of this committee, for your ongoing support of IPSE. Darcy gave you an update of the audit at the last hearing, so I'm not going to report details on that. But I do want to share with you some of last year's IPSE data and update you on next steps. As you all know, we're in the process of updating the data collection tool and methods that we use with the IPSE programs. That is based on a report done for us by Dr. Stephen McGarity and informed by the 2025 audit, and we will be rolling that out this spring. In the interest of transparency, we want to keep you abreast of a few data points. Here you can see the level of IPSE enrollment for the school year, 158 students across the 10 programs. That numbers remain fairly consistent with recent years. IPSE programs are not just about academics. They are higher education programs with significant components of employment and independent living. That report affirms, or I should say last spring, the committee asked us to gather a number of data points, which we compiled into a report. That report affirms that all students participate in internships during their IPSI programs. And it broke down the number of paid and unpaid jobs and internships, as well as job shadowing across programs. We're happy to resend that report as needed, and we will be sharing the data collected later this year using our new data collection instruments. One final current data point. We want to note that this school year, 121 of the 158 IPSI students are using IPSI grant state scholarship funds to pursue their higher education. So I want to talk about IPSI grants for a moment because IPSI students are not eligible for the Hope Scholarship. In 2023, IPSI grant scholarships were created with a sunset date, so we want to recommend that you make IPSI grants permanent. You may be seeing legislation shortly to make IPSI grants permanent, but we wanted to give you that heads up in that recommendation. Now I'd like to talk about IPSI technical assistance and monitoring. As you already know, we plan to transition GCDD's role in IPSI to another entity by July of 2027. We've had preliminary conversations with the Ralston Center for Behavioral Health and Developmental Disabilities and the Georgia Vocational Rehabilitation Agency. Again, the conversations are very preliminary, but we want to keep you updated. And we are really looking forward to working with all of our partners to make this transition a big success. Now let's talk about a topic that you hear about often. In fact, you've already heard about it today, and it's very important to the disability community, now and comp waivers. Now and comp waivers allow people with intellectual and developmental disabilities to live in the community instead of institutions. Only Georgians whose disabilities significantly impact their lives are eligible. We want to thank the Department of Behavioral Health and Developmental Disabilities for analyzing their own data and sharing the data with the Georgia Council on Developmental Disabilities, sharing the most informed estimate of waivers that are urgently needed. Based on that collaborative process, we have a medium-term recommendation and we have a state fiscal year 27 recommendation. This is our medium-term recommendation. You can see it's based on information presented to the DBHDD board this past December. 4,682 Georgians need a waiver now. As of March 31st, 2025, there were 7,833 individuals on the planning list. DBHDD data shows that 4,682 people are over 22 years old. This is DBHDD's own data. It is generally accepted that once they turn 22, virtually all qualifying individuals need a waiver. Additionally, a small number of children and youth need a waiver if the resources that are available in the state plan are not meeting their needs or all of their needs. You can also see from this graph that there are 364 people who are 61 and over who need a waiver. Most likely, one might assume that their primary caregivers of their youth are no longer around. And if they are, then they would be well into their 80s. So 364 people over age 61 need a waiver. You can also see that the age range is 2 years old to 89 years old. Let's please give the 89-year-old a waiver. $1,678 Georgians really need a waiver now. As much as we wish it were true, we know that the state would really struggle to add 4,600 waivers in 1 year. That's why we participated in a work group with DBHDD staff in 2025. In the fall, we all agreed to focus on the Georgians urgently in need of a waiver. Brooke Kubik went over these numbers with you in the budget hearing last week, so I won't repeat the numbers. But you can see this data from DBHDD this January that breaks down the number of people who are 60 and older, the number who are coming out of state hospitals and Gracewood Hospital, and so on. That is how the DBHDD staff calculated that 1,678 people will urgently need waivers over the next year. The end result is that 1,217 new waivers are needed for state fiscal year 27. Again, we want to thank DBHDD staff very much for all the work that went into calculating this number. How they got there is they took the 1,678 people who urgently need waivers, and they subtracted attrition, or people that came off of the wait list for various reasons, and people that came off of the waiver for various reasons. For example, death, moving to a nursing home, moving out of state. Right now, the budget contains 100 new waivers in state fiscal year 27. So to meet urgent need, 1,117 more are needed. We realize that there are a number of needs in the state budget, and we've heard about many of them today. We are hard-pressed to identify any unmet needs that are more important than this one, and disability is cross-sectional. These are some of Georgia's most at-risk families and citizens that have been identified as urgently needing these services to avoid crisis or avoid institutionalization. Now, DBHDD reports that with their current staff, they can process about 1,000 new waivers. For the additional 617 waivers, DBHDD communicated that they would need 26 additional staff for $2.5 million. You can see on this list here that it's broken down by roles. They provided us with this information. So why are we here, and why is Georgia struggling with this? The big driver is money. We as a state are investing relatively little into these Georgians. That is why we're urging you in the strongest terms to add money to the state fiscal year 27 budget and support the reasonable, data-informed request to add enough waivers and staff to the budget to support the Georgians most in need. This graphic shows why we struggle as a state in this area. Historically and currently, our state's fiscal effort, or our investment into adult DD services, including waivers, is unfortunately one of the lowest in the Southeast and in the U.S. And you'll see that Georgia's fiscal effort is lower than most states in the region and only 54% of the national average. This trajectory can be changed. This is a choice other states' leaders have made. This is a choice that state leaders can make, and we are committed to working with you to make it so. So I'd like Jess to come back up.
So our big ask today is for the 27th state fiscal budget. We recommend that you fund 1217 urgently needed now income waivers. We also recommend that you fund 26 new staff positions at the DBHDD.
I just want to add that there are a number of advocates here. Some of them are in the 1,217. We thank them for making the journey here today and look forward to them sharing their stories with you why this ask is critical for some of your constituents who, through no fault of their own, are very much in need. Jess is going to share one of their stories with you now.
This story is from Mrs. Vivian Curland. She could not be here today because she is at home caring for her son. My name is Vivian Curland, and I live in Johns Creek. I am writing on behalf of my husband, Ralph, myself, and most importantly, our son, Michael. Michael is 31 years old, and we have been on the Now and Comp Waiver waiting list for more than 12 years. During that time, his needs have grown increasingly complex. While our ability to support him without service has become progressively more difficult. Michael was born 6 weeks premature. At age 2, he was diagnosed with epilepsy. At 11, he was diagnosed with Crohn's disease and an autoimmune disorder. Later, we learned that he had GLUT1 deficiency syndrome, a rare genetic condition that affects the brain's ability to receive energy. This condition causes seizures, developmental delays, movement disorders, and lifelong neurological challenges. Michael is a loving and intuitive young man who understands far more than people often realize. He knows he cannot drive. He understands that he cannot maintain stable employment because of his cognitive and neurological limitations. He is also aware that he does not fit into the world in the way he wishes he could. Because Michael appears neurotypical, people frequently expect more from him than he can realistically give. This leaves him socially isolated and struggling to form meaningful connections. My husband and I have become the center of his world, and that is not the life a 31-year-old man should have. He wants independence, friendship, and a future of his own. Michael cannot manage money. He reads at approximately a 3rd grade level, cannot perform basic math, struggles with writing, and has fallen victim to scams. He experiences balance and movement difficulties, and a few years ago, he was struck by a car while crossing the street because he did not recognize the danger. He has no sense of direction. If he uses rideshare services, I must monitor his location continuously to ensure his safety. He calls me throughout the day for assistance with basic decisions. For example, he asks when to shower, when to eat, or whether it is safe to walk the dog. He has significant executive functioning challenges, struggling with hygiene, and cannot maintain his living space without assistance. My husband is 75 years old. He has prostate cancer, stomach ulcers, neuropathy, and has undergone shoulder replacement surgery. Despite his health challenges, he cannot retire because of the financial demands of our son's care are overwhelming. I am 65 years old and continue to work full time to support our son and manage his daily needs. We are doing everything we can as his parents, but we cannot carry this responsibility alone much longer. The waiver would not simply ease a burden, it would provide essential support for a human being. It would allow our son to live with greater independence, dignity, and connection. It would also enable us as aging parents to continue caring for him without sacrificing our own health and stability. We have waited patiently for more than 12 years. We are not asking for special treatment. We are asking for fairness, compassion, and the support necessary to allow our son to thrive rather than merely survive. Please fund 1,217 now uncalled waivers and help make this possible. Thank you. Before I say thank you as well, I have been starting each day with an affirmation, and I wanted to leave one with you today. You have the ability to take care of your citizens. I believe you can do that. Your disabled citizens are also part of your constituency. Take care of us too. Thank you.
On that note, we are happy to answer any questions from the committee.
Well, first of all, thank you. That was a wonderful presentation. Thank you for sharing that letter with us. And I know you are a great advocate and the voice for many who are not here and able to express their concern. There is no doubt that this is a real, and I believe, to use your word, a data-informed request. There is no doubt about that, and we will certainly continue to do all that we can. I want to see if we have any questions or comments at all from the committee members that are here. Okay, we have Representative Donahue.
Thank you very much. It's been a few years that I went and toured some homes, but let me ask you a concept for the future. If you were looking like condos, or where I'm going with this, at some of the colleges, they have 4 bedrooms and a common area, and it works great for college kids. But with it, I've been in one unit similar to that about 10 years ago. And looking at the future, is that a path that we could look at, or is it better to have 2 in a house or an apartment, or what's the common numbers?
I think that we could answer that by saying how does everybody on this committee want to live, right? For one person, having 4 bedrooms in a common area might be just fine. For somebody like me, I don't want to live, no offense to anybody, I don't want to live with 3 people that I don't know and didn't choose. My daughter is a college student at Kennesaw State, and they have 6 bedrooms and 1 common area, and they all do just fine. So it's about the person and how they want to live their best lives. So for some folks, living in a 4-bedroom condo is great. For some, maybe they can handle 1 roommate, and that's fine in a house or in a condo. So I think the possibilities, the living possibilities, are endless given the waiver. The person can choose how they want to live. Does that answer your question?
Pretty much.
I think anything is on the table for 4 or fewer.
I respect that because you're right. There's times I would like to be just me, okay? Sometimes it's my wife and I love the grandkids, and you can't ever really get enough of them. But then I'm looking at some that I went to see years ago. There were like 3 ladies living together, got along great. Another one had 4, one had 2. And, you know, touring this, I'm just trying to look at what's actually best, because everybody has different personalities.
Exactly.
Sometimes we don't get everything we want. I don't.
Right.
Nobody does. So I'm just trying to look at putting parameters around what can work.
Right.
And how to make it work. And maybe everybody's not happy, but we make it to where it's feasible for everybody to work toward being happy. And I'm asking because I have no clue what the answer is.
I would love to have a bigger conversation about that, because you're talking about housing affordability and all of that.
Right.
But without a waiver, we don't even get to that conversation about where and how people are living, because their parents have to still take care of them.
Right.
Or they are, living somewhere that they didn't choose. So we want to get to the point where we can have that conversation about how people live. They just need some assistance to do it.
Thank you.
You're welcome.
Any other?
Jess would like to just add to that for a moment.
Also, just one thing, college can last from 4 to sometimes 10 years. Living with people in that capacity could last decades, so that's also a consideration.
Any other from our committee members? You want to? Okay.
Thank you, Chairwoman. I really saw the data and see the data. This is the first time I've seen data that has literally gone through a standard and a procedure to place the needs in different categories and get down to the most critical needs. And so when I see this 1217 and then the total of employees, I have no idea how we do this, but I don't have an idea how we can't do it. Which, as I move around the state with GVRA and see the young people and older people who are just contributing to society because they have the supports they need, it warms my heart, but more importantly, it helps me to know that we're taking care of Georgians most vulnerable and keeping them in sight. I would love to be able to keep this in sight.
Thank you, and you're absolutely right. And I want to point out that it's not one way. People with intellectual and developmental disabilities want to work. They want to exercise their citizenship and their personhood and be part of their communities. They want to vote. They want to pay taxes. So it's not just receiving care, it's an investment in Georgia when you're giving people the support that they need, no more and no less, in order to exercise their citizenship. So thank you very much for what you're saying.
Okay, double check, anybody else? So I want to thank you too for the work. It's good to hear those are two great institutions about IPSI that y'all are looking and will be hopeful about possibly. I hope that can work out as I have a granddaughter who has benefited not only from one, but in the fall she'll be benefiting from another IPSI program. And I'm seeing the diversity and the difference firsthand of our different schools and how they do it. And I think it's real important to strengthen those programs as we move along, to continue. I know there's a whole generation of people that were so excited about getting them started that now have stepped away, they've retired, and their input and enthusiasm was gigantic, and sometimes it's hard to come back after that and continue that, but I think we can, and so I'm glad to see the enrollment is up. That's great. Those are great numbers. I hope that those students are all getting meaningful jobs on the campuses where they are or nearby. I hear from some parents that they're not, and so I hope that we can continue even in this interim process here to do that and to make sure that there's mentor engagement for that, that one standard class that they're going to, because often it's a class that doesn't really necessarily even appeal or relate. So I think there's some places we can work on there, making sure that it's a class. Just because you have a different ability, I would say, does not mean that you can sit in a college class and even process what's going on. So that mentor, having that really cool college kid that also wants to be there and help someone, I think the process to find those students is going to be even more important. And then also campus activities. Each of these campuses have a lot of activities. Yes. And I hear that a lot of the students are, some are finding them on their own way, but not necessarily encouraged to engage in some gathering time together as classes. And so there's a lot of downtime, is what I hear actually, for those students. And they don't necessarily need that, and their parents aren't counting on that because they are paying for college. So those are just a couple ideas I'd like y'all to take back as you go through this process, and we continue to make the IPSI programs even stronger and stronger along the way.
Yes, ma'am. And we had the pleasure of meeting your granddaughter at our last advocacy day, and she has tremendous potential.
She does.
And we're super excited about the transition of IPSI to another entity because we believe that it will actually improve IPSI. It will live at a place that can do IPSI justice and provide it the right support and supervision. So we're energized about that.
Well, I'm excited about it, and I hope we'll all be around to help do that.
Thank you.
As you make that transition as well, and have no doubt that we are going to continue to fight the Find the Dollars. It's called Digging for Dollars, actually, is what we do, to try to see what we can do to fund as many waivers as possible.
Thank you.
This year, as always. But thank y'all for sharing your story. Really appreciate it.
You're welcome.
Persevere. Okay, so we're going to start on our public comment now. And I want to start first of all with Katie and Houston Asher. If y'all would like to come up to the podium, that would be great. And Ms. Asher, if you would, at first, if y'all will just make sure and tell us a little bit about yourself too, so that we know where you're from. Oh, wow, good. Oh.
This is Houston Asher. He's 29. He has written what he would like to share with everyone. Right now we live in Cumming. My kids were raised, I have 5 kids. I'm a single mom of 5 children and have been taking care of Houston by myself for about 15 years. So it's a tremendous load, especially on single moms. Houston spent 21 years trapped in his body. We didn't know that he actually had understood everything. When he was 21, we found out about spelling, and that changed our lives, and here he is.
My name is Houston Asher. I spent my entire public education in a self-contained classroom where others made every decision of my life, only because I could not speak or control my body. Even though I was brilliant, no one knew, and they treated me like a toddler and deprived me of everything other students had. No one knew I wanted to be a forensic psychologist or that I could do complex math. No one knew I loved a beautiful girl. People do not understand what autism really is. It is not an intellectual disability. The experts are wrong and have been wrong about me my whole life. Their tests are broken and unreliable, just like our bodies. I do not have the ability to reliably direct my motor, including my speech. I have many other issues that make managing my body very difficult and cause others to judge my intelligence based on my body, which I can't control. I was trapped in my mind, unable to tell anyone what I was thinking or feeling, for 21 years.
Technology needs some work, I will tell you that.
God knows how much I suffered in my silence. That's when I learned about spelling my thoughts. That's when my life changed. Spelling gave me the power back to direct and take control of my life. Don't confuse motor with intelligence. Broken motor is not a broken mind, but it becomes a broken heart when we are treated like we are stupid and denied every freedom and opportunity in life. The reason I want to advocate today is to be a voice for others who don't have motor control. My purpose is to make sure you see others like me as your equals, as intelligent human beings that each have their own opinions about how to live their life and fight to protect their rights. No voice should not equate to no rights, no choice, no education, no meaningful career, no money, no inclusion, no respect, no love or children of my own, and no life. I think it's crazy that so many strangers have so much say over my life and how much help I will receive simply because I can't speak and need help to take care of myself. Those strangers don't know me or care about my life, but they should. I'm letting you see the real truth of how those with disabilities feel. How will I get a chance to make my dreams a reality without good help? My family has given up everything to help me. But all our state does is just keep making it harder to survive. Having a child with disabilities takes away their life too. Moms don't get any choice, or life, or a vacation, or even get to rest for one day. They give their entire life, all their money, energy, time, and future to us. How are they supposed to live longer to take care of us if you never help them? How are they supposed to save money for us to live when they are gone, when they can't afford to live now? The ones who give the most are treated the worst. So what I'm asking is for you to ask yourself, if you were me, what would you need to make your life worth living? How much money would you want to live on if making money wasn't possible? How much help would you want? Getting money won't change our bodies, but it will get us more help. The dreams of those with disabilities matter as much as those with able bodies. I can live the most meaningful life if you let me become the person I'm meant to be.
My son received a standing ovation for that same speech 3 years ago. Unfortunately, the state did nothing. The increase in waiver applications is largely due to the increase of profound autism, which requires 24/7 profound care. Today, we are here to discuss the allocation of resources, care, and the value of human life. How much are our children and our lives worth? This system has made us all slaves. These are the notes that the state requires me to keep. for the job that I am not paid to do. I do not get paid. This system requires us to use our children's funds to pay strangers to come into our homes to scrutinize our parenting and caregiving. Please show me the parenting notes that all of you keep and the strangers that you let into your homes to see what job you're doing. We labor without pay and with responsibilities that would crush every one of you. We have to navigate a system that treats our children like they are stupid just because they can't speak, and like we are potential perpetrators of fraud simply because we are in need. But make no mistake, we are not in need because we won't work. Work is all we do. We are in need because the truth was hidden, due process was denied, because people in power are afraid of how much the truth will cost. I am a lifelong Georgia conservative. Growing up, I never imagined I would be in the position to ever need help from the state to survive. But because my son was injured by vaccines, and I have proof, like many others, and denied due process, I am here today not to beg, but to tell the truth. We deserve and have a right to justice for the medical and institutional malpractice committed against our children and us. It is a shameful crime that the neurological injuries caused by vaccines have been ignored because no one wants to pay the catastrophic liability of destroying this many innocent lives from childhood. Profound autism is not an intellectual disability. It is a neurological injury caused by an autoimmune reaction in the body. In most cases, the trigger is the aluminum adjuvant in childhood vaccines. Aluminum hydroxide is a neurotoxin with no viable metabolic reason to be in the human body. It can cause an autoimmune reaction, destroying cells, organs, tissues, nerves, causing massive damage throughout the body, injuring vision, motor, auditory, nerve receptors, triggering encephalopathy, chronic inflammation. This inflammation is key because it prevents sensory and motor neural integration. That is what gives us all the ability to control our body. It also demyelinates neural pathways that already exist. This is the regression that parents often comment about. It causes a brain-body disconnect. It leaves these children imprisoned in their own bodies for their entire lives, and parents imprisoned in a state of life and death survival for the rest of their existence. I was 24 when my son was injured. This has been my life. Their inability to control their body has nothing to do with intelligence or behavior. Behavior is motor. Motor is a complex neurological process, so when there is neurological injury, they don't have control. It is not behavior. It is encephalopathy, brain on fire. This is why the dehumanizing educational and behavior models and plans of care of people who have chronic neuroautoimmune conditions are not just flawed, but harmful and traumatic. ABA and IQ tests do not address the problem, they are part of the trauma. This refusal to recognize injury and labeling injury as behavior and cognitive dysfunction has deprived those severely injured of all their rights, freedoms, relationships, opportunities, all life has to offer. This is criminal abuse and neglect by the state on its own citizens and children. It is obvious by the amount of money we are provided to survive how little we are valued, simply because our children are victims of medical and institutional malpractice, and no one wants to pay for the damages that were caused. We need and have a right to expect reform, justice, and help. This support should be equivalent to what you think your own life or your own child's life is worth. There is nothing in the budget that is more important than justice and innocent human life. Thank you.
Thank you so much. Thank you for being a good mother, for sure. It's great to meet you all. I'm glad you're here. Is there anyone that has any comment or anything?
I can provide all of the scientific studies that prove how all of this occurs, as well as the actual atomic structure of aluminum hydroxide and the studies to show how this causes the inflammation, as well as pictures of the images in the brain where they show the demyelination and images of the aluminum in the brain transferred there by macrophages, which are mobile immune cells.
I thank you. I thank you for that. And I know. Do you have Representative Mathiak?
Thank you, Chair Lady. Tell me about the notes. Why are you keeping
This
notes?
is what we are required. We have somebody to come into our home that comes out. We have to pay from our children's funding, and we have to show them the notes of care to prove that we are caring for our children and taking them to activities and all the different things we are doing. This is required every single time they come visit. They check our notes. This is what we live with.
And that's through the DBHDB
Yes.
office?
And by the way, DB, behavior.
Right.
Yeah.
I understand. I understand.
Yeah.
Thank you.
Thank you.
Yeah, just to clarify, so it's required, sorry, we're adjusting but it's required for what purpose? I'm not sure that we're understanding who's monitoring this or what. I'm not
The Department of Behavioral Health and Developmental Disabilities, this is their requirement on us. It is part of the individualized support plan that we file every year. Houston has had the exact same amount of funding because, of course, prices have stayed stable.
So it's a requirement to get the funding to help for services that he needs.
Yes, the system is loaded down with bureaucracy. What should happen is we have HSA cards that can be paid directly to the vendors, and the vendors themselves can take the notes and send them directly to the state if they want to review them. We should not be having to make goals, and this is ridiculous. This is an injury. We are doing our best to survive. I shouldn't be having to take daily notes of what I did with my child every day. I should not have a greater burden of caregiving than a normal parent.
Well, and I thank you for explaining that to us.
Yes.
And making us aware of it.
I'm sorry I'm emotional. It's very emotional.
No, you should be emotional. We usually get emotional up here before the day's over. You're just the start. Before we're through, there'll be a lot of tears up here.
And everyone should know that these non-speakers, they are completely brilliant and intelligent. They just have severe motor injuries. And when they learn to spell, not learn to spell, learn to point,
Right.
to spell out, what happens is their lives utterly change. And Houston was kept in a self-contained classroom, never taught anything but single-digit addition and preschool elementary material. And when he finally learned to spell, he started doing integrals and calculus and spelling out the entire Declaration of Independence and the Gettysburg Address. These are brilliant human beings. What the injury actually causes brilliance as well as motor dysfunction.
Right. Thank you so much. You've taught us a lot today. Appreciate it.
Thank you.
Next we will hear, and let me ask you this, if I call your name out, we're going to try to kind of organize this in a way about now and comp waivers to start with, and then we'll come back. So if I call your name out and you're not here for a now and comp waiver, if you just kind of wave, we'll move on and then we'll come back to everybody on the list, okay? So, Brittany Vaughn. Brittany Kruger, maybe? Kruger, is that it? Not now and comp, okay. We'll be back. Joel Lyon, no, okay. Oh, sorry, Rhonda Thomas, or Elise Ace, oh, Rhonda is coming up about it, okay, great. Thank you. I'm sorry. Okay. Thank you, thank you.
Good afternoon. My name is Rhonda Thomas. I live in Swanee, Georgia, and raised 3 boys, one of who is disabled and completely dependent for all care. This is Carter Jones. He's almost 24 years old, and the joy of my life, he touches others in ways many people can't. A little about Carter's background: he was born with cytomegalovirus. The virus ravaged his body and his brain, leaving him with multiple disabilities, including cerebral palsy, deafness, and profound intellectual disability. Over the years, he's developed severe scoliosis, hip dislocation, esophageal reflux, severe enough to require a gastric bypass, and G-tube, paralysis of one side of his diaphragm, severe sleep apnea, and Crohn's. He requires constant monitoring and total care. What his disability has not taken from him, however, is a positive attitude and the ability to experience joy and happiness. Carter loves social interaction, physical touch, and being active in the community. In 2011, Carter's dad was killed in an automobile accident, leaving me to raise 3 boys on my own. Because of the loss of his dad, Carter began receiving survivor benefits through Social Security. At age 18, Carter applied for disability, and when approved, the amount of Social Security he was receiving due to his dad's death was continued as adult disabled child Social Security. Unfortunately for Carter, this led to a 5-year struggle to regain benefits. The amount of Social Security he receives was above the Medicaid threshold, and Carter lost Medicaid benefits at age 18. After making multiple phone calls over the years to various agencies, spending $10,000 on an attorney, appearing in court, and calling on favors from people I know, Carter was finally able to get medically needy spend-down Medicaid, which allowed us to begin the process of applying for the now comp waiver. The system is extremely disjointed. We repeatedly heard no while seeking aid for someone entirely dependent on others. The very kind of person that needs help the most was denied help for years. The system needs a central point that can lead people to the path they need to take for help. More resources are needed to help the system work better. It shouldn't be such an exhausting and expensive fight to obtain benefits for someone that clearly needs it. We just completed the last step in the application process for the now comp waiver, and it's going to the planning list. I understand it could be months before we hear from the planning list, and no limited waivers are available. We hope Carter is selected to receive one, but hate that someone else may be denied due to limited resources. And this isn't in my speech that I gave you guys, but I didn't know the number until last night: 1,217 people. I want Carter to have a waiver, but how can I tell these other people no? It's heartbreaking. What Carter will gain from a waiver is quality of life. Carter aged out of school in 2023 when he turned age 22. Since then, his days are filled with doctor's visits and watching television alone while his stepdad works from home, thankfully, and I work at the local hospital. A waiver would allow him to attend a local day program for special needs adults. He misses school and the activities and social interaction. He deserves a fulfilling life and enrichment. Presently, he has very little stimulation and interaction. Can you imagine being trapped inside a body that will not allow you to do for yourself, and all you're able to do is watch television all day for lack of resources? Receiving the waiver would also allow for assistance for care at home: bathing, changing, dressing, feeding, changing positions, monitoring, lifting, utilizing medical equipment, and transporting him to the medical specialist he sees is all done by his stepdad and I while we both work full-time. I have a herniated disc now, and his dad has neck issues. Caring for a dependent adult is both physically and emotionally taxing. Getting support in the home will allow for better care for Carter and improve our lives by limiting further injury from the repetition of his care. Carter deserves and needs a comp waiver. So do many other families. These individuals touch people. They are bright lights in the world. The special needs community needs more help from our government. They cannot care for themselves. It is our privilege to care for them. This care should be everything they need, not the bare minimum and not difficult to obtain. Please allow for more waivers. Please take care of the least of these. I urge you to see this not as just a fiscal decision, but an investment in Georgia's families and our future. Thank you.
Thank you. Thank you. And thank you for leaving this with us, too. So we'll have that. That's wonderful. Okay, let's go back to waving if you're not about an outcome. Oh, you have a question? Want to just try? We can try. Yeah. Let's
Rhonda.
Ms. Tillman.
I have a question. Why doesn't Carter qualify for Medicare? If
I could sign him up for a Medicare plan, like a plan for doctor's offices and whatnot, but he's already on my plan because I work full time, so I always spend that extra money.
I got you.
But the Medicaid part of it was what was so ridiculous, and everybody in every agency that I've talked to, nobody knew what to do about his situation because it's unique. And literally, even after going to an attorney and sitting in court, finally started calling people. Actually, Ryan Wakefield gave me a name of somebody to talk to that helped me get him the Medicaid spend down, which we can't even use because he has insurance that pays his bills. So we get no benefit from it other than it let us get started process.
Thank you.
Okay, next is Elise Acey. Hi.
Good afternoon. My name is Elise Acey, and this is my daughter, Trinity. She has Down syndrome. She's very, very lovable, as she was trying to wave to you when you were walking by. But Trinity has been, since she was in middle school, waiting for a comp waiver. She went to high school, she did the program after high school, and now she's going to be 24 years of age this year. So she has been waiting for almost 10 years to get a comp waiver. When she was in school, they were telling her, like, what do you want to do when you graduate? She saw me go to college late in life so that I could provide a better life for her. And she kept telling them, I want to go to college. They're like, no, you could do. She's like, you don't understand. I want to go to college. Well, I'm a single parent. My mother and my sister did help me take care of them, but they're no longer with us. I'm the sole provider for my daughter. I worked for the federal government, for the CDC, for over 12 years. I lost my job due to the DOGE cuts. I worked on senior level executives, and I was told I was no longer valuable. So now, I have no income. My daughter gets Social Security, and that's how we live right now. My daughter deserves to have a life. She deserves to be able to go to school, to make friends. Our church that we attend is Westridge Church, and they built a special needs facility because they said that our special needs community out in Paulding County is the least served community out there. Thank you. And I'm sorry, I wasn't trying to lose myself. But she gets to serve at church for the first time in her life. She doesn't have to sit in a pew. She gets to greet people when they're coming into the church and get on the level of the children and say hello to them. She gets to be a part of a community at our church, which has been very enlightening to her life. They have given me the support to allow her to come to the program that they have there on Wednesdays for our special needs community, because at this moment, I can't afford to pay for it. The comp waiver would definitely change our lives in so many different ways because it will give Trinity an opportunity to be a valuable part of society. She wants to work. She wants to live independently with friends. She wants to be able to have a fulfilling life, and more importantly, she deserves that opportunity to do so. So it's unfortunate that they tell you when you have a special needs child that you need to start early. You know, you put her on this program, you got to put on this, you got to do this and that, and then here we are almost 11 years later still waiting for assistance and help. At one point, it was a little bit easier because I did have a full-time job and I did have support of my mother and my sister to be able to get her wherever she goes. She depends on me for everything. Even though she's high functioning, I have to tell her, make sure you take a shower. You know, did you clean your room? She'll ask me, well, is it okay if I do this? Because she needs help with day-to-day decisions and activities and being able to live, but she's a lighthearted, loving, as you can see, young woman. So it's like this young lady said, it's very disheartening that the fact that she loves to vote. Every time it's time for us to vote, she's like, we're going to vote. And I'm like, you're right, this is your right. You have a voter registration. I checked yesterday to make sure that we were still on the rolls so that she can have her right to vote. And it's one of the proudest moments that she has when she walks out with her sticker, like, I did it. It's important. These young students and young women and men that have disabilities, they are valuable. They teach us how to be human. I think we have lost humanity in this world. And so I'm just praying that you guys will find a way to make it to where families like us have the ability to allow her to have a life, because she deserves to have one. She deserves to be fulfilling in her life. She deserves to be looked at, not like there's something wrong with her, because there's nothing wrong with her. She's just different. She learns differently. She lives a little bit differently, but her heart bleeds just like us. So I thank you for the opportunity of standing here today and being able to have a conversation with you, and for you to meet my daughter, Trinity AC.
Thank you, and thank you, Tracy. Thank you, thank you, thank you. Let me ask you this.
Yes.
Where do y'all live?
We live in Paulding County.
In Paulding County, okay.
And so my church has a big advocacy for children with disabilities. And
Good.
so, you know, they've been helping me try to get before someone that would actually even we haven't even had we didn't even have an interview for 11
Right.
years. She had a liaison. I haven't spoken to this woman in 4 years.
How close are you to Rome?
Well, let's see. I live in Dallas, Georgia, so I know there's
About
Dallas.
40,
It's
about
not far.
45 minutes.
Mhm.
I'm going to tell you there's a great program in Rome, my hometown.
Okay.
But it's called ESP, Extra Special People. There's camp,
Mhm.
there's weekly activities, there's all kinds of things, and there are people from birth to way into their 50s that are there with their families.
Mhm.
I think they are a program that we also support here at the state, but they are throughout. But we happen to have one in Rome, and I'd encourage you to look that up online.
Okay.
You may find some resources there that you have not
Yes.
so far.
Well, thank you. I appreciate that.
Yeah,
You
extra special people. ESP.
They are extra special people.
That's right. That's
Have a
right.
great day, and thank you.
Thank you. All right. Not this one, okay. Read well, I'm sorry. Thank you for that.
Good afternoon, and thank you for allowing me this opportunity to speak. Again, my name is Demetria Coleman. I am on this side for an advocate, a nonprofit organization owner, as well as a family member. I work closely with individuals with special needs and their families every day, not just from a desk, but from daily life, homes, doctor's visits, care plans, behavior challenges, progressive milestones, and caregiver exhaustion. What I want to share to you today is not just theory. It is what happens when support is delayed or unavailable. We all know that when individuals age out of school at 22, school services end, not gradually, but immediately. It stops structure, therapies, most of the time stop, social development opportunity stops, and families go from having a coordinated system of support to carrying everything alone, unless they receive a Medicaid waiver or the financial backing of their own. And there are many individuals who are still waiting just to get an interview. The waiting list is not just long, it is life-shaping. Skills that took years to build can fade when they are not reinforced. Social confidence drops, communication weakens, isolation grows, caregiver stress rises. I want to share with you a real experience. I met this young lady named Kylie at Kroger about 7 years ago. She was in a school program, and it was her work environment. She aged out of school last March. Her job stopped. She's no longer working, and her family did everything they were supposed to do. They followed the process exactly as they were told. Applied early, submitted all the documentation, and they have been patient. She is still waiting. Her mother is her primary caregiver, and now she's experiencing early dementia. Kylie depends mostly on her mom, and her mom is slowly losing her memory and clarity. Their communication has become hardened, misunderstandings have happened, and Kylie has started to socially and emotionally withdraw. Without structure, community engagement, and funded support, her world is getting smaller instead of expanding. That is what the gap looks like in real life. And the issue doesn't only begin at age 22, it starts much earlier. My own little nephew, he's 5, he has significant support needs. His grandmother is now his primary caregiver because his parents became overwhelmed trying to meet his daily developmental and care demands alone. That decision came from love and from exhaustion. She is still waiting for them to give her an interview or some type of support. I personally watched my sister pour herself into his care to the point where she neglects her own health and well-being. Caregiver burnout is not a dramatic language. It is real, physical, and emotional. Our family steps in regularly to give her breaks so she can recover, because without relief, she cannot sustain the level of care he needs. When she first asked for help, she was told to wait until he was 3. Now he's 5, and she's being told there is no funding available for his age group. The need is still present, but the support is postponed. Families are being told to wait during the exact years when developmental issues matter most. Early support prevents deeper challenges later. Delayed support increases both human costs and financial costs. When families reach the breaking point, the system ends up paying more through crisis services, emergency care, and institutional placement. Preventative and community-based supports is not only more humane, it is more cost-effective. I know budgets require difficult choices, but this is not optional support. This is continuity of care across the lifespan. I feel there are some practical steps that would make a real difference, like prioritizing waiver access for individuals aging out of school, prioritizing households where caregivers are elderly or medically declining, providing a bridge service while families wait, expanding early age and transitional age development supports, and of course, increasing waiver slot funding to better match documented needs. These are not luxury services, they are for stability. I ask you to look beyond the line items and see the households behind them, the caregivers running on empty, the young adults losing progress, the children whose developmental window is open right now. Support just does not disappear at graduation. Support should not depend on who can endure the longest. As a family member, we are asking for lifelines, not abstract policy ideas. A waiver is not just a paperwork. It is transportation. A waiver is therapy. A waiver is community. A waiver is skill retention, safety, and hope. When we fail to fund these supports, families are forced into impossible choices, like quitting jobs, risking their health, leaving loved ones without engagement. I believe Georgia is strong enough to do better with budgets, and we know that budgets are not just moral documentations. They show who we see and who we don't see. I ask that you see Kylie, that you see my nephew Darius, that you see the individuals whose voices are not in this room, but those whose futures are shaped by what happens in this one. Fund the waivers, expand the access, and strengthen the bridge between education and adulthood. Families such as mine and those that you've seen and who've spoken here today are doing everything that we possibly can. We're not asking the state to carry the load. We're asking you to meet us halfway, because from early childhood to adulthood, the need does not disappear, only the support does. And as a nonprofit leader, I see families on a daily basis calling my company asking, do you have at least 4 hours of respite available? Is there something that you can do? Waivers, supports are just so delayed, and the families need care. They need respite hours, and oftentimes they can't afford it. Some people charge $65 a day for a day program. Some go up to $120, and it's just not affordable to some families. I see it daily, and I try to help as many families as we can. This year we served 25 families. Last year we served 25 families with respite care on a weekend and during the holidays. And I've seen the changes that it just helped just one family for a day to just have a peace of mind. This past Friday, I took 10 people to the Tim Tebow prom so their parents can still have respite, and provided our team to take them so that they wouldn't have to worry about getting up and taking them, and we did that for them. And it was such a relief to see them have that. So the waivers, increasing the waivers would be a big, huge help for those families. Thank you.
Chairman Mayfield.
Thank you, Chair Lady. I heard you say for your son or daughter, I'm sorry.
My nephew.
Nephew. Is funding separate per age group? Is that what I heard you say?
So there is a difference. There's a program called Family Ease. It works for all individuals, but most of the time you start at the age of 3. When you get they typically ask that you get the diagnosis at 3, and starts to lead into being able to be accepted into a program at the age of 5. You can get it sooner, but most of the time the kids are between 3 and 5 years old when they're able to get Family Ease. And right now there are only 2 businesses that provide that support, and that's Bobby Dodd and In Community. They provide that service, and their list is long as well. Those individuals that want Medicaid waivers, that's a separate from Family Ease. That's a different budget that you all provide for. However, those children then lead to the pathway to be able to get Medicaid and comp waivers with having those services.
Thank you.
You're welcome.
Thank you. Any other questions or comments? Thank you so much
Thank
for
you.
staying with us this afternoon and sharing your story. I appreciate it. Okay, let's see. We're trying to find the now comp waivers. Let's see, how about Jennifer McGee?
Good afternoon. Here? Here. Thank you. And thank you so much for hearing us today. I'm Jennifer, and this is my husband Brandon, and our nephew Isaiah. We adopted Isaiah in 2020, and he has profound autism, and he's nonverbal, and has severe intellectual delay. In 2020, we were able, because of the shutdown, to really get to know Isaiah and his needs. Although he's our nephew, and I was in the room when he was born, I really did not understand how difficult it is to take care of a disabled person with this level of disability. And prior to 2020, Brandon and I had a thriving business, and we're in the event industry. And in 2021, we tried to go back to work. We almost lost our home because there's no one to take care of Isaiah. My mother tried, and we tried hiring caregivers. He broke TVs, he broke our refrigerator, he'll injure himself. And he's a wonderful young man, but he just needs special care and people that understand how to take care of him. I was really grateful that we started this session with prayer. Because Prayer is very important. And God wants us to take care of our disabled people. And I have to tell you, as a Georgian, how angry I am that there is such a significant amount of people that need our support, and we have to stand here and grovel and beg for support. Isaiah deserves a life of dignity, and so does my husband and I and our family. We are good people, and we try to do the right thing. So do these other families that need help. It is embarrassing to see the statistics that I have seen today. Embarrassing. It is not fair. Georgia can do better. And that's all I want to say.
Thank you so much for being good parents and for loving your child. And I'm sorry it's hard.
I need to understand that caregivers that take care of disabled people like this have PTSD. These waivers give caregivers respite and also pay caregivers because you can't work. So, I mean, you're not, it's just crucial. I'm just embarrassed that we don't do better by our most vulnerable people. So please, please fund these waivers.
Thank you. Thank you for your time. Fana Mitchell, I believe, on behalf of Holly Christian. I don't see Fana. Okay.
Hello. I will be reading a statement on behalf of a parent advocate, a mom who couldn't be here today. She is out of Alpharetta, Georgia. My son Chase is autistic and began exhibiting increasingly violent and destructive behaviors at the age of 24. Since that time, his condition has significantly deteriorated, profoundly impacting our family's daily functioning, financial stability, and overall safety. Chase experiences frequent and unpredictable behavioral escalations characterized by intense screaming, forceful banging on walls and doors, and the destruction of household items. These episodes can be prolonged and severe, requiring constant supervision and intervention. Due to the ongoing disruptions, noise, and need for continuous monitoring to ensure safety, I was unable to maintain my employment while working from home and ultimately lost my job. His behaviors have extended beyond our home and environment, even during family vacations. His outbursts have been severe enough to result in law enforcement being contacted due to disturbances. These incidents have caused significant emotional distress, financial hardship, and increasing social isolation for our family. In addition to destructive behavior, Chase has demonstrated repeated episodes of physical aggression, resulting in injury to family members and serious safety concerns. During a family cruise, he struck his grandfather, who is 84 years old, that lives with us, with a phone using substantial force, nearly causing a wrist fracture. On another occasion, he bit my husband, who's 61 years old, with such severity that it resulted in permanent nerve damage and lasting scarring. Additionally, my 22-year-old daughter was required to physically restrain Chase to prevent imminent harm to other members of our household. These events illustrate the unpredictable and potentially dangerous nature of his behavioral episodes. Chase has also caused substantial property damage during periods of emotional distress. He has climbed and walked on the roof of our vehicles, resulting in structural damage. Within our home, he has broken doors, punched holes in walls, and destroyed antiques, household furnishings, computers, phones, and other personal property. The frequency and severity of these incidents have created ongoing safety risks and considerable financial strain. Given the intensity, unpredictability, and harmful consequences of Chase's behaviors, our family is struggling to maintain a safe and stable living environment. His condition requires continuous supervision and significant intervention. Additional services, structured supports, and comprehensive resources are urgently needed to ensure both his well-being and the safety of those around him. Chase is unable to maintain employment due to the severity and unpredictability of his behavioral symptoms. He requires constant supervision, frequent consoling, and ongoing intervention throughout the day to ensure his safety and the safety of others. His behavioral episodes occur nearly every day and significantly interfere with basic household functioning, including routine activities such as preparing meals and driving safely. These episodes occur multiple times per week and may last for several hours or, at times, extend over the course of several days. During these periods of escalation, Chase is unable to respond to redirection or calming strategies. On particularly severe occasions, he will remain awake throughout the night, sometimes until 6 a.m., screaming continuously. These prolonged disturbances not only reflect the intensity of his dysregulation, but also further destabilize the household by disrupting sleep and daily functioning for the entire family. Due to the persistence and severity of these behaviors, I have sought assistance from numerous physicians, psychologists, and behavioral specialists in an effort to secure appropriate treatment and stabilization. Many of these services require substantial out-of-pocket payments due to limited insurance coverage, which resulted in significant financial strain. Despite these efforts, Chase continues to exhibit severe functional impairments that prevent independent living and sustained employment. Again, I'm reading this statement on behalf of Holly Christian, who is a mom of Chase Christian, who is now 28 years old, out of Alpharetta, Georgia. Thank you.
Thank you. Thank you for being here for them. Okay. Next. Oh, thank you. Thank you. Oh, let's find my place. Where was I? I was right there. So now I think this is next. Is that right? I don't know. Daniel Bryant.
This is Daniel Bryant. I am his father, Tracy Bryant. Good afternoon, Madam Chair and committee members. Thank you for this opportunity today. I would like to read a letter from a Georgian who was not able to be here today because of work requirements. His name is Paul Terry, and if I may, I would like to read that letter. My name is Paul Terry, and I am a grandfather and legal guardian of my granddaughter, Kyla. I took custody of Kyla when she was only 5 weeks old. At that time, she was on a ventilator in a pediatric intensive care unit. She had 2 skull fractures that were already beginning to heal. Every rib but one had been broken, and she had a broken clavicle and broken leg. Some of these injuries were not fresh. That means the abuse started from the very beginning of her life. When I was finally able to hold her, she had a tube coming out of her brain to drain fluid. She later underwent surgery to place a VP shunt, which she still has today. At around age 3, she had another major surgery to relieve pressure at the base of her skull so her spine could function properly. Because of the trauma she endured as an infant, Kyla lives every day with the effect of traumatic brain injury, grand mal seizures, and significant cognitive disability. She cannot be left alone. She requires constant supervision for her safety. But that is not who she is as a person. Kyla loved school. She graduated from Kennesaw Mountain High School in 2023 and stayed in transition services until she aged out at 22 years old in October of 2025. She played soccer in the neighborhood, shoots 10 out of 10 baskets, and hits a baseball with confidence. She worked hard to learn to walk and to ride a bike, and she has worked just as hard to build a meaningful life. Today, I am her sole caregiver and her sole source of income. I applied for the Now Comp waiver and for temporary assistance while we wait. That assistance has run out. I cannot afford the programs that would keep her safe during the day. The cost is $75 to $100 per day. I work full-time as a salesman. Many days I have no choice but to take Kyla with me to work and hope my employer does not find out, because if I lose my job, we lose everything. This is not sustainable. It's not safe for Kyla, and it is not a position for any working Georgian should be in. Kyla is on the urgent waiting list for services. She is one of the 1,217 Georgians whose needs have already been identified as critical. I am not asking for something extra. I am asking for the support that will allow my granddaughter to be safe and that will allow me to continue working and caring for her at home where she belongs. Funding these waivers is the difference between stability and crisis for families like mine. It allows caregivers to keep their jobs, to prevent unnecessary institutional care. Most importantly, it gives people like Kyla the chance to live in their communities with dignity and safety. Thank you for your time, your service, and for your consideration of the urgent need to fund these waivers. Thank you. My son, Daniel, has the waiver. He would like to talk to you about what that has done for him, but would you like us to wait for that presentation? Okay, I'm going to turn it over to Daniel.
Hello. I'm sorry, I was loud. I know I'm funny. That's one. My name is Danny Bryant. I am 35 years old. I work at Publix for almost 3 to 4 years, and I graduated from Kennesaw State University. I work at Publix, which I know I said that. And what this waiver has done with me is that I've been waiting for this waiver for 10 years, and I appreciate this because I am very active, and I'm living independently with my roommate, Bradley Carlisle, which you might know him, but he's funny, active, talented friend I have. And with me, of course, I am active and kind, smart, and thank you for me to talk today because I appreciate this day. Thank you.
Daniel, thank you to you and your father for sharing not only your own story, but the story of another. We appreciate it very much. Go Owls, right? Okay. Next, Rebecca Valdez. Waiver. Yeah.
Thank you.
Thank y'all. Thank you so much.
Nice to see you, Dave.
We'll shake hands with you. Thank you.
Nice to meet you.
Good to meet
Nice to meet you, Dave. Thank you for all you do.
I'm Rebecca Valdez, and this is my daughter, Linda. Tomorrow is Linda's 30th birthday. Happy birthday. She has been on the waiting list, planning list, they call it now, since she was a teenager. She does have a job. She had a job and she lost it because she did not have adequate job support. She's gotten another job, and there's been some difficulties, but we're trying to work through it. The waiver would give her the job support that she needs to keep her job. I had to quit my job because I was taking care of her and my mother and helping with grandchildren. I would like to get back to work, but can't do it right now. Linda lives at home with her dad and me. Like any 30-year-old woman, she would like to be out on her own. She's lost skills and just what everyone else before here said about getting out of school. It's like you drop off a cliff. The state spends so much money doing so well by our kids, and then they turn 22 on their birthday. They're out of school, and everything that they've learned, it starts going away because they're not using it. They don't have help. So we're asking you to please fund these waivers. These people deserve it. They say that a society is judged by how it takes care of the least. And but these society has so much to people with disabilities have so much to offer our society. So let them get out there and live their lives with support. Thank you.
Thank you. Thank you so much for being here. And thank you, Lisa. Margaret Stone.
Chairwoman, members of the committee, thank you for the opportunity to speak today. My name is Margaret Stone. I live in Dunwoody with my husband Benjamin and our daughter Lauren. Lauren has two younger siblings, one of whom is in college and the other has graduated. And Lauren is 28 years old and has cerebral palsy. She was diagnosed at about 18 months. We didn't know at first what sorts of problems she was having. And Lauren is an incredible, sweet, loving human being, but her disability is lifelong and requires full-time support. She cannot live independently, and her care needs are significant. Lauren is ambulatory and can feed herself and dress herself, but she does need assistance in all of the higher-level tasks behind those activities. She can't plan, shop for, cook her meals independently. She needs help to pick out appropriate clothing and to wash her clothes. While she can give herself a shower, she needs supervision to make sure she does a good job. And she can walk, but doesn't always have good sort of spatial awareness, such that if we're walking in from a parking lot, she might drift into the traffic lanes instead of staying on the side by the cars. She can't be left at home alone because we aren't confident she wouldn't wander away from the house or answer the door to a stranger. Also not confident in how she would react in case of an emergency. She'll never be able to drive a car and needs assistance getting to her community access group that we were fortunate enough to be able to send her to. She, even doing something like riding MARTA Mobility, it would be difficult for her to arrange that. Something like, I know somebody mentioned like sending their child on Uber or Lyft, and can't really see Lauren doing that. So I hope this gives you sort of some idea of the type of support that Lauren needs on a regular basis. In 2017, Lauren was approved for services through the Now Comp waiver. I'm not sure I'm getting the terminology correct because she was basically put on the planning list. So she has not received any services through Now Comp, but she is on the planning list. And although she has been approved for 9 years, she's never received any of the services that the waiver is intended to provide. The lack of funding has left Lauren on the list without access to the support she's been qualified for. When we've inquired about family support money, which you may be familiar with, and there are certain agencies that administer that, we've basically been told that unless we're completely unable to provide for Lauren, we're not eligible to access any of that money. Her benefits navigator for Region 3 for the Medicaid waiver has basically said if we aren't accessing family support money, then they don't see that Lauren would be eligible anywhere in the near term for funding through the waiver. So it feels kind of like a catch-22. Because of the severities of Lauren's disabilities, I left my career as a physician many years ago to help care for her. And whereas like a lot of moms, as their kids get older, maybe the kids get into high school, they're like, okay, these kids are independent enough, I can go back to work. That's not really the case with Lauren. And so it places a lot of strain on our family, not only on my husband and I, but also on our grown children, who also are very sweet and kind to help out with Lauren, but they have their own lives to build, and school and other responsibilities. With the services funded under the waiver, we could see Lauren moving to a group home setting where she would get the support she needs and also have greater independence and what would be more appropriate for a 28-year-old. Without these services, obviously we're going to continue taking care of Lauren at home, but we worry about, what's going to happen when we can't take care of her anymore. I saw it said that there were some people waiting on the waiver who were over 60. My biggest fear is that that's going to be Lauren, and I'm going to be the 93-year-old who hopefully is still around to take care of her. I really appreciate y'all's attention, and these have been some incredible stories that we've heard here. And I appreciate your attention to hear about sort of the challenges that the families are facing and what this means in real life for the families who are affected. Thank you very much.
Thank you so much. Thank you. Thank you for being a great mom.
Yeah, thank you.
Kelly Fields?
Good afternoon. Before I launch into this thing that I wrote, I did want to just say that I'm Kelly Fields. I'm a mom, and I want to thank you all, Madam Chairwoman and members of the committee, for the time that you're spending listening to our stories. I know that the day can get long for you all, so I do appreciate the time and attention from you guys today. I live in Gainesville in Forsyth County, and I have 4 boys and a daughter-in-law, 27, 22, and then identical twin boys that are 14. So I'm here today as a parent. It's my honor and privilege to stand here today. As I mentioned, I'm a mom, and I'm also a wife, and I'm a veteran educator in my 24th year of teaching special education. But today I'm standing before you as the most vulnerable of all my titles, because today I'm here as Carter's mom. And Carter is my 22-year-old son who has autism and epilepsy because of a chromosomal deletion that doesn't have a fun, fancy name. It's not common. It's got a bunch of numbers and letters, 16p11.2. And Carter's disabled, developmentally, intellectually, in all of the ways that would allow him to be a typical adult at 22 years old. And so I'm here today because as his mom, his entire future as an adult child is hanging in the balance of your budget decisions today and tomorrow and in the weeks to come. I'm standing here today as the voice of one of the 1,217 adults who desperately need approval to begin receiving the Now Comp waiver funding. In your positions, I'm sure you hear from many families, as you have today, and I know public comment, as it has been today, is filled with desperate voices. I too know what desperation sounds like because I am the teacher that families come to when they have nowhere else to go. My students have significant learning disabilities. And my classroom, my self-contained classroom, is often the last stop for parents who have poured every ounce that they have of time and hope, money, and energy into trying to give their child every chance they can to succeed. And when they stand in my doorway, they're exhausted and they're scared. And today, I'm the one who's exhausted and scared as a parent, and I'm standing in a doorway, your doorway. And I'm here because I've run out of doors to knock on. I'm here because this really is my last play, my Hail Mary. And I'm throwing every ounce of remaining strength and voice that I do have into fighting for the one thing that I know will allow my son to continue to live and grow and learn once he ages out of public school, which is May 15th, 2026 for him. Yours is the door that we all run to when everything we've worked so hard for hangs in the balance. For 22 years, my son has fought for every inch of his progress. 22 years of therapy, 22 years of doctor's visits, IEP meetings, extended school year services, medications, battles with insurance companies, waiting lists for specialists, and waiting lists for waivers. Every skill my son has built, he built with the kind of effort that most people like us will never fully comprehend. And now, as he approaches the end of his public school services, he's staring at what families like mine call the services cliff. One day, my son has structure and instruction, a community, purpose. He's valued and loved and cared for. And the next day, there's nothing. If the Now Comp waiver is not fully funded and accessible when young adults like my son age out, then what exactly have we as their parents and our children been working towards building for 22 years? What was every intervention for? What was every skill we worked for years for? What was that for? What was every painstaking step toward independence for? Was it all so that they could just land on a couch in my living room? Was it all to watch hard-won independence slowly erode because the system that told us to plan never actually planned for him. My son has done everything asked of him. I've done everything asked of me. I followed the rules. I got on the list. I waited 11 years and counting. I complied. I trusted that when the time came after more than a decade, the support would be there, and it is not there. We had our annual review Thursday the 12th, and I was told my son just doesn't have enough need. I was actually told, and this isn't in my speech, but it would have been better for my son to be a ward of the state because homelessness is an urgency elevator in the determination of need. It's pretty hard to hear that when you've poured your whole life to the impact of all of my other children in my marriage, that I would have been better off to let him be homeless or a ward of the state. Because then maybe he would have received the services at 22. This is not theoretical to me. This is not a line item. This is my child's life and his life trajectory. This is whether he continues to gain skills or begins to lose them. This is whether I can continue working as a teacher, as a special education teacher in the state of Georgia. Whether I can continue serving the children of this state as a special education teacher, or whether I must walk away from my 24-year career to provide the supervision my son requires. Your decision today and in the days to come will either allow my family to continue to have a roof over our heads, because my husband and I both can continue to work and contribute to our family and our household, or it will be the decision that forces us out of our home, that takes my son's ability to participate in an adult day program away, but also as well as him being able to participate in any other opportunities or activities, because those extras cost money we will no longer have because of the loss of my income as a teacher. You speak often about supporting educators. You speak about teacher shortages, increasing teachers' salaries, and the impact the loss of good educators is having on students and families in Georgia. And you speak about strengthening families. Funding the Now Comp waiver is how you do that. It's not in speeches. It's not in slogans. It's in actions. I'm not asking for special treatment. I'm asking you to honor the promise you made to families like mine, that if we plan, if we comply, if we wait our turn, the system will be there when our children reach adulthood. Right now, it's not. And if it remains underfunded, then you're not just balancing a budget. You're deciding whether young adults with intellectual disabilities in Georgia, like my son Carter, move forward into meaningful adult lives and communities that love them and invest in them and support them. Or whether they disappear into isolation the moment they turn 22. My son did not fight for 22 years to be parked and forgotten. Please do not let his future and the futures of thousands like him, so many of whom you've heard from today, end with a fall off of a cliff because the funding did not match the promise. Thank you so much for your time this afternoon.
Thank you so much for hanging with us and telling us your story and being a good parent and teacher. Next up, I believe we have Kayla Rodriguez.
just going to be reading off my phone, if that's okay. My speech is on my phone. Okay, there we go. Hello, my name is Kayla Rodriguez. I'm here today to speak about the now comp waivers. So, as many people have spoken about today, and they were all great speakers, so I'm going to share my story. The Georgia Council on Developmental Disabilities, aka GCDD, is asking the Georgia General Assembly to fund new now comp waivers for at least 1,217 people who urgently need it as part of the state budget this year. I am one of those 1,217 people who urgently need the waiver. I know I don't look or act like a stereotypical disabled person who needs these services at first glance, but trust me, I am disabled and I do really need it. And trust me, my mom, she has fought a lot for me, just like many of the parents have here too. I am autistic, have ADHD, and I'm a type 1 diabetic. For starters, I need help with day-to-day tasks. I don't drive, so I need help with transportation. The waiver would help with that. I don't currently have a job, so the waiver would help me find and keep a job. I don't cook and I need help with hygiene. My sister and my mother help me with these tasks, but they can't help me every day. The waiver would allow me to have a caregiver to help with that. If I don't have someone to support me, my life would surely be at risk. My mental health would worsen and I could end up in poverty or be homeless and, or dead. The now comp waivers are technically an optional service that Medicaid offers. But for many Georgians, including myself, the waivers are essential and mandatory in order for us to live, thrive, and contribute to society. Also, DBHDD needs more employees to administer these waivers. GCDD is asking for funding to hire 26 new DBHDD employees to help administer the amount of non-comp waivers we are asking for. The suggested number of 100 waivers being added to the state budget by other sources simply isn't enough. It's not going to cut it. There are over 7,800 people on the waiting list for the now comp waiver. Everyone on the waiting list or the planning list for the now comp waiver needs it. But funding for at least 1,217 waivers is enough to make sure those who urgently need the waiver, like me, can get the life-saving services that the waivers provide. Georgia has billions in dollars of surplus this year, so we could surely fund at least 1,217 waivers and 26 new DBHDD employees. The now comp waiver is life-changing and life-saving, simple as that. Please consider funding at least 1,217 waivers and 26 new DBHDD employees so many people like myself can work and live well. But if you could fund more waivers and DBHDD employees, that would be amazing. Thank you for taking the time to hear this. Thank you.
Thank you for being such a strong advocate.
Oh, you're welcome.
And telling us your story. I don't think there are any questions for you, but I know that everybody is proud that you're here today.
Thank you.
Thank you so much.
I appreciate you having me. Thank you.
All right, is there anyone else here that signed up to speak to the waivers that we have not called on, that we've missed? Great. Okay, great. We're going to go back to the list now. Okay, well, first of all, we're going to call on Dr. Daniel J. Gibbs with the University School of Social Work. Thank you. Thank you for being patient. And then back to the list, so don't. Lawyer.
Yes, thank you, Chairwoman and members of the subcommittee, not only for having me, but also for prioritizing the voices of the advocates we've heard today. It is often really hard to introduce humanity into some of our institutions, and I think hearing those voices is really, really important. So thank you for prioritizing that. I want to say it is an honor to be able to be invited to talk about my work, and which I know has been mentioned in this subcommittee a few times. But equally, it is an honor to be a part of any effort that shows the kids that I'm going to be talking about today that we are in their corner. And so I do want to thank you as well for your leadership on this subcommittee for doing that, for asking the right questions, seeking to understand better how we can build systems that actually support and allow these kids to thrive. So a little bit about me, and I'm not going to take much time on this. So I'm an assistant professor at the University of Georgia School of Social Work. I've been there about 3 years, but before that, I was a child welfare attorney in my home state in South Carolina. And so that means a couple things. One is that I see this work both from a systems level and an advocates level. We've heard in several hearings before about people putting things in court orders, extraordinary things in court orders, because these kids need it. And I have been that crazy person putting those things in those court orders before because sometimes these kids do need things that are simply extraordinary. And so I'm going to talk a little bit about why that is. But I do want to mention, too, that I'm here as an advocate. I'm not here to lobby for any entity or organization or for any specific legislation. But what I am here to do, hopefully, is to provide some context for some of the patterns we're seeing in our system, and also to help us sort of have a laser focus on what our system needs to serve these kids better. And so I want to introduce us just with a sort of silly metaphor, and like all metaphors, it does eventually break down. But I want us to imagine a system, the foster care system in Georgia, as sort of a hydroelectric dam, right? We have a lake that is all the children who are encountering our system, and that lake is filling up, and we'll talk about why. But we also have a dam that is showing some cracks, right? It was never quite designed for the population it's finding itself serving these days. And so we have some challenges, ways that I think our system has been trying to patch these cracks desperately. But we have a desperate need to fix the dam, right? To improve it in the long term, to make strategic investments that will make it not only be able to sort of hold these children, to place them, to minimally serve them, but to help them thrive. And so today I'm hoping to talk a little bit about why the lake's filling up, what some of these cracks are, why we're patching them the way we have been as a system, and also some of the future things that I think are really important that we've seen in other states and in the research evidence. So why are we seeing rising levels of complex need among foster youth in Georgia? The very, very short answer is that everywhere in the country is. On a population level, we are seeing rising rates of anxiety, depression, externalizing behaviors, disruptive disorders in all youth across income levels, across states, across geographies. The causes are very complex, and we can certainly talk about the ways that society is making life a little bit more difficult for kids, but suffice it to say that more kids than ever are seeking to use our system of youth mental health services. And this is both youth who are system involved and youth who are not. As we've heard today from a lot of the advocates we've heard from, our families are often trying to beat down the door to get services early when their kids first need it. I'm myself a parent, and if my daughter needed one of these things, I would be trying everything I possibly could to get these services. But quite frankly, too often, they are met with a wait list, a similar wait list for desperate and immediate needs, and they just don't have the magic words to unlock those services before becoming involved with the system. And so what ends up happening is sometimes because of those needs, sometimes for ordinary child welfare reasons, they become involved with our system. And I've done some research, particularly in North Carolina, coming right out of the pandemic, where we were described by folks within the system and folks trying to seek services in the system as there being a double access problem, right? Folks that are trying to seek preventive services for their kids, and so finally they turn to system involvement out of desperation, only to find that the system itself has been tapped out of services for their kids, for the complex needs they have. And so basically what we have seen is that foster youth already had higher rates of mood and disruptive disorders, but we don't know how this sort of incoming surge from a quantitative standpoint, has changed this population, and more importantly, how it has led us to pursue some less than ideal solutions to make the system work. So some of these charts and graphs have been shown in prior hearings and cited by some of my DFACS and DHS colleagues. But I just wanted to point out a few key numbers. That's part of the benefit of being a university professor, is that I have the ability to look at some of the federal data that we have. Unfortunately, the federal data is only able to give us some clues, right? It is very imperfect. If you can imagine a telephone game of our children and families meeting a frontline professional who hopefully puts the right data in our system, and then that system then reports to our federal government, who then reports to the custodians of these federal data. A lot of things can be missing by the end of that telephone game, and that's what we're working with, particularly in recent years. So I would say years from 2021 to now, we have a lot of missingness. And so what we do have, though, is also quite thin, but I will tell you what we have seen. Overall, the total population served in foster care has been sort of smoothly heading in a downward trend after the COVID-19 lockdown period. And also, as you can see in the sort of green, yellow, and red graph up there, something interesting has been happening in terms of how long youth have stayed in our foster care system in Georgia, exceptionally so compared to their national comparisons. And that is, we've seen fewer short stayers, which is actually, in a lot of cases, a good thing, right? These are children who maybe didn't have to come into foster care in the first place that aren't coming into foster care. But what we're seeing in the red is that the youth who are staying for more than 2 years is growing substantially. And so myself and one of my colleagues at the School of Social Work, Dr. Allison Dunnigan, recently gave a presentation at the Child Welfare Summit in December, looking at who these youth are and what some of the trends we're seeing are. They are older than their peers when they come into the child welfare system, and the age of the entire child welfare system is actually shifting older. And with that, we're also seeing a greater than the national prevalence increase in youth who are labeled as having what's called an emotional disturbance in the data. This is sort of a catch-all term for any youth with a mental health or behavioral health disorder. Because it is a catch-all, it tells us very little of what actual conditions they have, and actually when they received that label, whether it was before or after coming to the foster care system. But we do have that count for the youth that we have the data for, right? There is a lot of missingness. But I do want to point out two trends, and these are the two sort of duckbill-shaped graphs at the bottom. One is that we are growing in the proportion of youth that are served that have received this label officially. This means that maybe the raw number of youth is not going up, right, because the total foster care population is going down. But the proportion on, let's say, a caseworker's caseload that has complex needs, typically a lot of placement instability, and is staying longer, that's making up a lot more of the day-to-day work of our providers, our casework staff, and our system as a whole. Interestingly, we actually, and this I don't think has been shown in prior hearings, the last graph here actually shows that a decent proportion of that increase is being seen outside of our urban and sort of middle-sized cities in the state. And this actually matches anecdotally what we hear in our system, which is that a lot of these needs are arising in places that simply don't have the resources locally to serve them. And so actually, while this should raise our sense of urgency, underneath the hood, there's actually more urgency because not only do we have fewer foster parents than ever to serve them, and particularly foster parents who are willing to take older youth with complex needs, we are also seeing this increase in places that may not have service networks to serve them close to where they live. And so what this means is that not only are we not quite equipped to serve them, but the consequences may be compounded by things like geography and the capacity of our system that has seen decreases in capacity coming out of COVID for both foster parents, our workforce, and our service providers. I promise I'm not just citing DHS because they cited me several times, but this graph was presented on January 23rd in this subcommittee and shows sort of what the impact has been, how our service has responded. Because our system was originally designed to serve a younger global population of kids, I believe that coming out of COVID, this sort of system of state-funded, emergency-approved services, for the large part, constitutes our way of sort of putting a Band-Aid on the crack. And so what you see in this graph is a sort of skyrocketing amount of transportation and behavioral aid supports, as well as other supports. Commissioner Brose mentioned as well that some of this has been in response to ensuring that we are not hoteling youth or keeping them in emergency rooms for a long period of time if seeking placement. There are many, many reasons why this may be, but suffice it to say, a lot of what these services do is help us create placement opportunities, maintain placement opportunities for youth that may not have them, or may otherwise disrupt, or may otherwise have nowhere to go and may get stuck. Many of these services, and in fact there's a lot of incredibly qualified provider folks here to talk today, are critical supports, constant supports, sometimes the most consistent supports for these youth that we have. However, a lot of the services that we're funding to make things work are neither effective nor evidence-based. And so what that means too is that on one hand, limiting them, which I know has been a topic of discussion, will probably shift the strain elsewhere, but continuing business as usual may be a missed opportunity to ensure that we're actually proactively investing in a system that serves these kids well and delivers outcomes. Because the best way to solve this crisis is to have a system that actually makes them well, that lets them thrive, and lets them return home into family-like settings, right? And that means investing wisely in treatment solutions that are in the right funding stream and also effective. Because if we simply just limit some of the expenditures that we've seen, we could see things like foster parent and workforce turnover, and also, even worse, unmet youth needs. So what do we go from here? Unfortunately, I will say in all bold type, there is no silver bullet for this, right? There's no one thing we can do. But I do believe that there is a solution in which we can fund not only short-term solutions for the lack of resources that we have to deploy for these youth, but also longer-term planning and coordination and investments, things that have shown promise in other states, because again, this is a national problem, are investments and coordination around therapeutic foster parenting models, right? These are parents who are specifically trained to serve these youth and recruited for this purpose, right? Which can build capacity and make them more effective at serving these populations. In some states is actually Medicaid fundable. Also, investing in additional Medicaid billable intensive wraparound services, making sure we don't cut those services. Also, making sure that we are delivering extremely comprehensive and rapid assessments to make sure we're actually delivering the services to the kids that most need them. All of this has to be done not in isolation, right? Not just one agency doing these things, making these decisions, but through actually, I believe, formal and well-supported, financially supported efforts, right? We like to think coordination, collaboration between individuals, professionals, agencies just happens, and it doesn't. It has to be supported, it has to be formalized, it has to be inclusive, right? It has to include our provider communities, our paying agencies, it has to include the MCOs, the managed care organization, right? As well as the courts, right? Planning with the courts how to move forward and thinking with the front line. And, of course, the university professor is going to say this, but I believe that the only way to plan this well and honestly, to provide accountability and transparency in the way that we move forward with these investments is to guide these decisions with better data, right? I will say the data that I'm able to show you today is insufficient for the planning that we have to do. But we have these data in our agencies. We have these data by combining efforts and formalizing our coordination, even on a small local level, right? Demonstration projects, pilot projects that just allow us to have a start. I think we can link data to give ourselves not only an audit of how we're going to handle this situation, but a way of deploying data to provide a robust needs assessment, right? Of who these kids are, what they truly need, and what is a process evaluation of how we're serving them and how we're improving our system. And lastly, providing more robust data will actually be able to tell us, did what we do work, right? Are we actually producing well-being and thriving for these kids? And without that data, it doesn't give us much to convene around as a system. And so I do think that's critical. Other things that I will mention too is not all of these kids probably needed to enter our system in the first place, right? So we do have to invest in our prevention and navigation supports, particularly in places where families often are assessed as needing these services, right? It's schools and in primary care settings. That's our main touch point before they reach the dam, so to speak, of the foster care and juvenile justice system. And so with that, I think that is at least a couple clues for how we can move forward, not only to sort of plug the gaps that we've seen in our system, but to make it a more effective system that will allow these kids to thrive, because that's what they deserve, right? Just because they have labels that often cause them to be viewed as difficult children, if they were my child or any of our children, we would want them not just to be taken care of and placed. We would want them to go on to have meaningful lives where they're independent, where they are well and healthy and taken care of by family. So thank you.
Dr. Gibbs, thank you so much. Thank you for this work. It's good to hear it. I appreciate your patience today for hanging with us. You had an exercise, no doubt, of listening, as we all did as well, to some very important voices, as you said. No? Okay. We've got more presenters, and that was just someone that stepped out. Thank you so much. Safe travels. So I'm going to go ahead and start calling the next name out, and we will persevere here. Next up, I believe, is did we do that one? Spencer Harden and Victoria Hemley.
Hello. So thanks for sticking it out with us. I want to thank the committee and Chair Lady Dempsey for allowing us to speak before you all today. My name is Spencer Harden, and I am the Advocacy Manager at the Alzheimer's Association. And I'm here today to advocate for a $2 million budget request for FY27 at the Department of Human Services for a Dementia Caregiver Support Program. So currently in Georgia, we have over 188,000 residents living with Alzheimer's disease in the 65 and older age population. Obviously, accompanying those that are living with the disease are the loved ones that are taking care of them. Based on studies in 84,000, and obviously their care is no small task. Actually, here in Georgia, our caregivers provide about 775 million hours of unpaid caregiving service, and that's evaluated to be around $13.3 billion. So, within those studies, they've also shown that taking care of someone living with dementia, they often face longer hours, they have increased involvement in household tasks like managing finances. They have increased involvement in personal care tasks like bathing and feeding. And this is really resonant of a lot of the stories today, but oftentimes caregivers will prioritize the one they're actually providing care for and neglect themselves. So oftentimes caregivers find themselves in poor physical health, battling with depression, and feeling socially isolated. So today, the Alzheimer's Association is advocating to establish the $2 million dementia caregiver support program to provide necessary reprieve to dementia caregivers in Georgia. This program is intended to be housed at the Department of Human Services and administered through the Division of Aging Services. The program would operate as a grants-based program in which qualified service providers can apply and be awarded a grant for support services, innovative support services like music therapy programs. This would allow for caregiver support service providers in and around communities to provide services that are reflective of the local community's needs. So with me today, I actually have Dr. Victoria Helmley. She's a wonderful advocate for us, but she'd also like to share her caregiving story.
Thank you for your time today. Yeah, like you said, thank you for sticking it out. So I was a care partner for my dad who lived with Parkinson's disease for over 25 years. And with his Parkinson's, he also had dementia. So his Parkinson's symptoms were gradual. He lived, like I said, for a very long time with the disease. But about 12 years before he died, which was just in November, his executive functioning started to deteriorate, and it was evident that our family needed to give him extra support, including daily oversight, help with managing medications, and finances. He also began to have trouble with his balance, and I want to kind of reiterate that dementia is not just memory loss, so his personality changed, his mood changed, and he was very difficult to get along with. In 2020, his care needs became the center of our lives. So during the height of the winter surge of COVID, he fell and needed surgery. And after a week-long nightmare hospitalization, where he spent several days alone, my dad's care needs grew exponentially. He now needed help with all of his activities of daily living, and he needed 24/7 oversight. So from that point on, his mobility and cognition declined steadily. His hallucinations and delusions worsened significantly. He was agitated, very difficult to care for. He needed hands-on caregiving for every aspect of his life. So my mom, myself, and my sister, we made a pact to care for him as long as we could at home because we did not want him to have to go into a nursing home. I will say that he briefly did get support from a CCSP, a Medicaid waiver. It was brief, and it's a story for another day, but it was honestly an added stress to our life rather than helpful. So caregiving for him was emotionally and physically exhausting. We were all still working, so we relied on support from other family members to step in, and we had some paid care so that we could go to work. The cost of his care, which was just during the day, 40 hours a week, was about $50,000 a year. That doesn't include the other costs like supplies, medications, and for my family, some of those costs were offset by the fact that my dad had great insurance, which not everyone has that. The bottom line is my family sacrificed a lot, and to be honest with you, I would do it all again if it meant that I had my dad back with me. But caregivers in Georgia, they need our help. They need caregiver education, they need respite care, and anything that can offset the financial burden of caring for their loved ones. These families, not all of them are as lucky as mine. We have resources, we're well educated, we're well supported by friends, and we luckily had flexibility in our jobs. That's not the case for every Georgian. Take it from me, there are dementia caregivers as we speak in this room who are sitting at home feeling defeated and wondering how they're going to get through another day. I know they're out there because I've been there. So we don't have a way to cure these people. Sorry. But we can show our support, all of us, including those under the Gold Dome, that we're here for them until a cure comes.
Thanks, Victoria. Again, I'd like to thank the committee for allowing me to advocate for a program that would provide much-needed support for dementia caregivers in the state of Georgia. This disease affects roughly around 12% of our 65 and older population. Our 65 and older population is the fastest growing age cohort in Georgia. So we know that because it's the fastest growing age cohort, we know that the necessity of care will only continue to grow. So I hope you support this appropriations request in order to help make Georgia more dementia capable for those living with the disease and those providing care for them. So thank you.
Thank you, and thank you for sharing your sweet story. Okay, next we have Emily Acker, maybe? That's great, thank you. Yeah, there's one for you.
Thank you so much for the opportunity to speak with y'all today. I'm going to be succinct and hopefully be very clear about our request. I am Emily Acker and I serve as CEO of Hillside, but I'm here today representing all 6 psychiatric residential treatment facilities in Georgia. The psychiatric residential treatment facilities have, at the current time, about 620 licensed beds. Our collective request is for $1.5 million or $250,000 for each PRTF in state appropriations to enhance discharge planning programs for Georgia's youth transitioning from residential treatment back into their communities. Effective discharge planning is critical to ensuring continuity of care, reducing relapse rates, preventing child abandonment, and equipping families and caregivers with the necessary resources to support long-term stability. As you've heard in many forms today, the complexities of children and adolescents and their families have intensified over the last 5 years, and the PRTFs face extensive challenges in providing thorough and effective discharge plans with lasting impact. The requested funding would be used to hire and support discharge planning specialists to work alongside the family therapist, ensuring that each child and family receive the dedicated discharge planning support for their individualized needs. What we're finding today is many of our families are struggling with instability, whether that's housing instability, food instability, transportation challenges, along with access to adequate mental health treatment in an outpatient basis after a residential stay. In order to help these families in a very individualized way, it takes specialty workers to really canvass their communities, make sure that we can identify the services that they need, and provide more of a wraparound support to these children and families so that they can continue to be successful. One of the things we don't want to see is children returning to our care repeatedly, ending up in emergency rooms or in crisis stabilization, when if we had done the work very carefully the first time and provided all the supports that they needed at discharge, we could prevent that from happening. We hope to see improved outcomes, stronger family dynamics, and reduced risk of abandonment by providing these services. The funding will also help us continue to track data to see the impact of these specialized services around these children and families, and hopefully be a cost saving ultimately to the state as well. Thank you.
Thank you so much, and Thank you for the great information you're giving us as well. Chairman Mathiak, do you have any questions at this time or anything?
The organizations on the side of the stationery are who you represent or you work with?
The Georgia Alliance of Therapeutic Services has about 19 members. I'm here representing the PRTFs, which is Hillside, Youth Villages, Devereaux, Coastal Harbor, Lighthouse, and I apologize. Laurel Heights. My neighbor, Laurel Heights. Yes. So the 6 PRTFs. Thank you.
Well, I don't see any other questions. Thank you so much, and thank you for the work you do every day. Catherine Bassel.
Good afternoon, Madam Chair. Good evening, I should say, and members of the committee. Thank you so much for the time. My name is Catherine Vassell. I'm the CEO at Partners for Home. Partners for Home has the pleasure of serving as the lead agency for the Atlanta Homeless Continuum of Care. I wanted to come today to share a little bit of our progress about the Rapid Housing Initiative. When Mayor Dickens came into office a little over 4 years ago, he met with us and said that we had been doing good work, but we needed to do more and we needed to go faster. And so with that charge, we agreed upon to create a public-private partnership to develop 500 new units of supportive housing for the most vulnerable people in our community who are experiencing homelessness within 24 months' time. We launched an incredibly innovative initiative by leveraging publicly owned land to build modular construction housing on that land, and I'm really excited to share that to date we have delivered 388 of those 500 units, and we have another 112 units that are actively under construction today and will deliver in April of 2026. With the work that has been targeted to rehouse unsheltered individuals in the downtown area of Atlanta, we hit our milestone goal of rehousing 400 unsheltered homeless individuals this past Friday, and we look to make a public announcement in the next couple weeks in partnership with the city. This initiative is leveraging over $100 million between the $50 million bond, Housing Trust Fund dollars, some private funds through the Community Foundation, in addition to the project-based vouchers that will cover the cost of the rent subsidy on an ongoing basis over the next 20 to 30 years. We are leveraging almost $100 million to make this initiative happen. The missing link, however, is the ongoing supportive services. This committee has been incredibly helpful in helping us to secure the ongoing services funding for the Melody, which was the first initiative of the Rapid Housing, the 40 shipping containers that we renovated and turned into supportive housing for people who are now formerly homeless and living stabilized, successful lives. So to that end, we are seeking ongoing, recurring supportive services for the remaining 460 units that we are developing and have developed to date. We are leveraging the subsidy, and our original cost for the services was about $13,000 per unit per year cost. With the rental subsidy that we're receiving from the Housing Authority, we have been able to offset the supportive services cost by about 30%, bringing that total cost down to about $8,700 per year per unit. And our current ask is a formal subsidy. We are also going to be partnering with Tier 1 plus CSB providers like Claritel and Grady, who can seek reimbursement for both the uninsured for the services as well as through payers like Medicaid and Medicare. So I think this may be, hopefully, one of the first or very few asks that are coming to you all that will start at one number, but hopefully reduce over time with the reimbursement through various payers as well as the relationship with the State Department of Behavioral Health. I have a few pictures here in the deck, and the second last slide here that just give you a visual of the products that we're delivering. Brand new construction and or acquisition of completely renovated units that we've brought online in desirable, amenity-rich neighborhoods, as we are actively putting people who are literally homeless on the streets of downtown today into housing, and that again is 400 to date. So I will just close there, and I'm happy to answer any questions that you might have.
Chairman Mathiak, do you have any questions? Okay, we'll go for it.
Okay, so when you say wraparound services, and you've got 400 people already housed, do you help them find jobs once they're healthy enough to do that, so that they have some responsibility for rent, or what does that look like?
Absolutely. So in pages 3 and 4, we outline the types of supportive services that we provide. So it's a 2-to-20 ratio. It includes a licensed clinician, so a LCSW or licensed professional counselor, a licensed clinical social worker, as well as a certified peer specialist. Those are both reimbursable services through the state of Georgia. Those services are provided on site at the facility, and they work on an individualized basis with each person that moves into housing to come up with an individualized service plan. So by way of an example, at the Waterworks site that we've brought online, we have one woman who is actively working on her sobriety. She's been sober since she moved in, so her care team is really helping her to get support for her treatment and her addiction and get on the road to recovery. We have another individual who has a disabling condition. However, he was ready to go to work right away, and he's already secured a part-time job across the street at Chipotle, and he was offering me some steak tacos last week when I went to visit. So everybody is on a unique path. At the Melody, we have some individuals there who are in hospice care. They have multiple comorbidities, chronic, severe health conditions. We have one individual there with stage 4 cancer. So everybody is on a different journey and a different path. Everyone that, in order to qualify for these units, you have to be designated chronically homeless, which means you have a disabling condition and a long length of stay in homelessness. So we are truly prioritizing people that have long-term disabilities, may not go to work, but some will and do, and then move out and secure their own housing. Some move into affordable subsidized senior high-rises and other types of housing, and some stay with us indefinitely.
And then
the rent, I will just add, is never exceeds 30% of the person's income. That's where the voucher from the Housing Authority, ultimately through HUD, is so critical.
And then how long is chronic homelessness?
The definition of chronic homelessness per HUD is a year or longer, or 4 episodes in the last 3 years that total a year or more. So these are people that are truly stuck in homelessness, and but for this intensive service and housing, will really not exit on their own.
Thank you.
Yeah.
Well, I will just say thank you for the continued work you do. I enjoy reading about you and hearing about you in other places as well, and this is a great document for us to have.
Thank you so much.
As we consider that. Thank you. Okay, next we have Claire Cantrell.
I prepped my remarks to say good afternoon, but I think we're in evening now. So good evening, Chairwoman Dempsey and members of the subcommittee. Thank you for giving me the opportunity to speak today. My name is Claire Cantrell, and I serve as the Deputy Director of Together Georgia. I come before you this evening on behalf of our Executive Director, Judge Juanita Studman, and our members from across the state of Georgia, several of whom are here today. Together Georgia is the association representing Georgia's child welfare provider community, and our members serve children and families involved in the foster care system across every region of the state. Our providers partner closely with the Division of Family and Children Services to provide safe, stable placements and critical supportive services. First, I want to thank the entire committee for your continued support of Georgia's children and families and for all of your hard work in addressing the budget challenges that the department and the provider community have faced this year. On behalf of our members, we are deeply grateful to the committee for the restoration of funding in amended fiscal year 26 and including the money to restore needed contracts and services that were canceled late last year. We really appreciate your leadership on these issues. Today, I'm respectfully requesting that the subcommittee fully fund the contract and special services for children and families in line 28.11 of the out-of-home care budget, and that these funds be specifically included in the fiscal year 27 budget. These contracts and special services are essential to ensuring children in foster care have access to the placements, therapeutic supports, and stability they need to heal and thrive. They are not currently highlighted in the budget as a specific line item, so we are requesting that they be addressed and included. Additionally, I would like to voice our strong support for increased funds for growth and utilization in line 28.11.6 of the DHS out-of-home care budget. As the needs of children become more complex and utilization fluctuates, it's critical that the division's budget reflect the true cost of care and the capacity required to serve these vulnerable children and youth. I really enjoyed Dr. Gibbs's testimony. He has been a friend and partner of Together Georgia for a while, and I think he put some really interesting numbers and context around just how hard it is to serve these kids. We are grateful for your commitment to ensuring that the division's budget is fully funded and aligned with the realities of serving these vulnerable populations. Thank you for your leadership, your partnership, and your continued support of the providers who stand ready every day to care for Georgia's most vulnerable children and families. Several of those providers will speak to you as well from their perspective. Thank you for your time and your consideration. I'm happy to answer any questions that you might have, but like I said, several of the folks that are on the ground doing the work every day are going to come behind me, and hopefully they can also help.
Thank you. Okay, next is, that really loud there. Jackie Conliff? Oh, Stacy, I'm sorry. I thought that was a J. I'm sorry. Conliff Hopkins?
As Claire said, good evening at this point. Thank you, Chairperson Dempsey and the subcommittee. Thank you for the opportunity to speak. My name is Stacy Conliff Hoskins, and I'm here on behalf of the child placing agencies that are members of Together Georgia. We want to urge you today to strengthen Georgia's investment in our foster care system. Please fully fund the out-of-home care budget and ensure funding for contracts and services to Georgia's vulnerable children and youth and their families. Child placing agencies are private organizations that arrange for the temporary care or permanent adoption of children. CPAs work with the Georgia's Department of Human Services to recruit, train, and support foster or adoptive parents, providing case management to ensure the well-being and safety of children in foster care. We provide 24/7 care and support to those youth placed in our licensed foster or adoptive homes. To help you gain a clear picture of how many children CPAs currently serve, recent data shows that out of 9,695 children under the age of 18 placed in foster care throughout Georgia, child placing agencies provide care to approximately 4,000 placed in our licensed foster homes. That is nearly half of all children in foster care being placed in our foster homes. Georgia's children deserve safety, stability, and the chance to thrive, yet we know that too many of them are growing up in a system stretched far beyond its capacity. The challenges we faced are not abstract. Over the last few months, you have continued to learn and hear about the ongoing newer challenges faced, including some of the following: decreased reimbursement rates, since there are no longer enhanced waivers to help us and our foster parents care for the youth with more complex needs and much higher acuity, yet these complex needs and higher acuity has not disappeared. Also, due to direct services support unit support service cuts, these needs and acuity have only increased. Children are not visiting their families as scheduled. Some have not seen their biological families or siblings in over 2 months, even though it is part of their reunification plan. CPAs are now frequently asked to take on some of these court-ordered requirements. This includes being asked to transport children to visits with their biological families and or siblings as part of their reunification plan, or we are asked to provide transportation to court, which at times can be 2 hours or more one way. We are now also being asked to have our employees or foster parents supervise these visits, which can present a whole new level of risk and expenses with no reimbursement to our organizations or foster parents. Foster parents are especially put in vulnerable situations when asked to supervise visits with the bio parents that their children then get to go back to the foster homes after those visits end. One recent example is a bio parent who then followed the foster parent home after that visit was over. Lastly, due to growing insurance costs, these added risks pose a challenge as insurance companies will not support these risks and have told some agencies that they could or would be dropped. These challenges have had a substantial impact on our foster youth in Georgia. There are a growing number of examples where our youth haven't seen their parents or siblings and have asked, "What am I doing wrong? Does my parent not want to see me? When will I get to see them?" All of which increases their trauma, anxiety, depression, behaviors, problems in school, and more. As a little bit more insight, all licensed foster parents with the child placing agency are required to be employed as part of their licensure. Yet they are being asked to step in and transport and supervise visits for more than 2 to 3 children placed in their homes who are not always related or from the same counties. This is on top of having to manage the already complex and individual day-to-day needs of each child. As CPAs who employ social workers, therapists, case managers, leaders, and more, it is our goal and passion to help meet these needs. We do not want to have to say no to any child's greatest needs. We also understand a CPA contract asks that we provide support with transportation and visits, and we do this in many ways. Our foster parents or employees provide transportation to routine medical and dental appointments, sometimes school and therapy appointments, recreational activities, and more. Our foster parents also help ensure that our youth are prepared for supervised visits and ready to receive their children upon return, which can sometimes be emotionally draining after they've visited their bio parents. If we are being asked to do more and outside of what is considered feasible and appropriate, we need help. First, we need increased funding to stabilize and retain our child welfare workforce and foster parent population. As many have mentioned, high turnover of either foster parents or employees means children experience more disruptions, having new caseworkers, new placements, new schools. When we invest in competitive salaries, manageable caseloads, and support services to our foster parents, we reduce turnover, minimize burnout, and improve outcomes for children. Second, we must expand support for foster families and kinship caregivers. Foster parents are essential partners in this work, yet many feel overwhelmed and under-resourced. Increased stipends, access to respite care, and better training can help families stay in the system longer and provide stable homes. If child placing agencies are expected to transport and supervise visits, those requests should be funded so that we have well-trained employees and foster parents who can supervise visits appropriately and safely. And we need insurance costs to be covered, as this is non-negotiable for most of us. Third, we need targeted investment in mental health and behavioral health services for children in care. Many children, as we all know, enter foster care with trauma that requires specialized treatment. Without timely access to therapy, crisis stabilization, and trauma-informed care, placements can break down and children can cycle through homes. Funding community-based providers and expanding availability of high-quality services will reduce disruption and help children heal. Finally, we must prioritize older youth and those transitioning out of care. Every year, young people age out of Georgia's foster care system without permanent family connections. They face higher risks of homelessness, unemployment, and involvement with the justice system. Expanding transitional housing, education support, and workforce programs is not only the right thing to do, it is fiscally responsible. Investment on the front end will likely save state funding in other areas of the system. The appropriations decisions you make this session will shape the lives of thousands of children. When we underfund foster care, children pay the price. When we invest in it, we strengthen families, reduce long-term state spending, and build a safer, healthier Georgia. We urge you to prioritize reinstating support services, increase funding for workforce stabilization, foster and kinship support, mental health services, and transition age youth. Georgia's children are counting on all of us to get this right. Thank you for your time and your commitment to the well-being of Georgia's children.
And thank you.
Thank
I know,
you.
take a deep breath. You
Thank
waited
you.
a long time, too.
Yes,
And I
thank you.
appreciate that.
Thank you.
I appreciate
And I
it.
have some examples, like real-life examples that CPAs have been sharing more recently that I can leave with you all. We can also email them to you. Yes.
I have just a couple things I wanted to ask you. Thank you. How many children do you allow in a home?
It depends. It can be.
If there's all siblings, you would keep them in one home. But
Yes.
let's say they're not siblings. How many children?
You can license up to 6 beds per home. If you're in DeKalb or Fulton County, that's limited to 3 beds per home.
Okay. And then how far are they from their community? The children be placed?
The goal is to always place them as close to their community as possible, but it also depends on the bed available or, the available homes for that particular child.
Okay. And then you said that Together Georgia sees about half of the children in
The
foster
CPAs, yes. So the CPAs serve about half of the kids in foster care in Georgia, meaning DFACS homes have the other youth.
Okay.
But we serve more than, close to half of them.
Okay. And then you said that some of the people are having trouble with car insurance. The insurance companies are questioning that?
Yes, the agencies getting liability insurance, I believe. I'm not sure if I'm saying that right.
Okay.
But I can give more of that.
Thank you.
Any other questions?
No.
Thank you so much. We appreciate it, too. Next is Brittany Kluger. No.
So good evening as well. I had good afternoon on here too. So thank you, Chairwoman Dempsey, members of the committee, if any are watching. My name is Brittany Kluger, and I serve as CEO of Family Menders, a partner with DFACS for 24 years, serving children in foster care, but also those at risk of entering foster care. We provide services over the entire continuum of care to directly impact safety, bonding, and family stabilization. I last spoke to you in December, 2 months today exactly, about the dire situation regarding what we still face 101 days later. I do want to thank you for recommending to fill the full deficit. I am here today as a member of the association Together Georgia in support of the 2027 budget. We are asking the state to fully fund out-of-home care, DFACS contracts, and direct services for FY27. Stability in placements and prevention of child abuse and neglect requires stability in funding. As you consider DFACS spending plans, we encourage strategic investments that promote family stability and prevention and reduce long-term cost. Our motto is the quick and caring response at Family Menders. When a family needs child welfare supports, they must begin quickly to preserve attachment and promote successful outcomes. In child welfare, speed with oversight is essential. We fully support the responsible use of Medicaid services when applicable. Providers have a duty to be ethical stewards of taxpayer dollars, and we take that responsibility seriously. Insurance should be utilized first for medical necessity services. We also support the long-term transition to Medicaid where appropriate. However, that credentialing, compliance, staffing, infrastructure can take years. With this FY27 budget, families need the ability to receive the needed direct support services while the study committee, thank you for that as well, looks at improvements in the system. We cannot pivot completely and risk families not being supported like we currently are. Even with Medicaid expansion, critical services such as supervised visitation, transportation, parent education, parenting assessments, drug testing, and other evaluations are not covered by Medicaid. One huge aspect of the future budget is not only the allocation of the funds, but reopening easier access to the services. The current authorization process is creating measurable service disruptions over the last 101 days. We have been informed that approximately 95% of service requests submitted to state office are approved. That suggests those requests are appropriate, yet referrals have declined dramatically, which leads many to believe the requests are just not being sent. Prior to November 7th, our agency averaged anywhere from 80 to 100 referrals a week. Since November 7th, we are less than 10 every week. That is almost a 90% reduction in service access. I do want to add there that we had over 1,000 authorizations in December 31st. That's the primary date they use. Of those 1,000, we've received 26 reauthorizations. Conversations with fellow providers indicate this trend is widespread. When referrals drop at this scale, children are not receiving services. They're not receiving counseling, supervised visitation, behavioral supports, transportation, and other stabilization services. Parents are not getting their needed assessments, visiting their children, drug screening, or receiving parenting services that can increase their parental capabilities. Providers are often told from county staff that they've been told to look at community resources. However, over 3 months later, the current approval process, and we hear stories weekly, I do think some were submitted to you by Together Georgia, of clients not receiving any services at all since this halt in November. We also have been told it's not a halt, but it very much feels that way on the ground. The other aspect are, especially in rural areas, there's no community resources available to fill child welfare needs. The current process of state approval for services across the entire state is not sustainable. County level staff are the people that know their cases. They know their caseload and they know local resources. Case managers are carrying expanded responsibilities, which reduces their time available to complete this lengthy state approval submission. They're being asked to transport kids to do the visit supervision. Combine that with turnover and burnout, this creates even more instability for our most vulnerable children. We respectfully ask that moving forward with the budget to move away from the lengthy state approval process, to have DFACS county supervisors be allowed approval on those routine child welfare service authorizations with defined guardrails and audit oversight, and reserve the extensive state office approval for your higher cost or your higher intensity services. This would preserve fiscal accountability while restoring timely access to services. We're also seeing major confusion about insurance eligibility and what can be shifted to be covered by Medicaid. Many of the Medicaid counseling services that we receive do not meet the medical necessity criteria. I stated it back in December, and I state this because I've been asked this. It's unethical as a clinician to diagnose a child improperly just to switch a funding source. So those times like that, county's been told you need to go to Medicaid services, they don't qualify. Those kids are just not getting any services right now. providers are not simply vendors. We're long-term partners. This is our 24th year. As partners in this work, we've remained available to talk through service availability and funding options and how we can all remain good stewards of public dollars. Those strong partnerships, though, require communication, clarity, and shared accountability. I have shared many ideas with state office on ways I think we can save some state dollars while not adversely harming youth. I want to add that providers cannot absorb the upfront cost of services through the Family First Act. I know that's been brought up in some discussion, and that's your prevention services, and that's a huge part that has been missing the last 3 months. Family First Act, many of those are financial burdens of training, staffing, and compliance, and investments that you have to really put forward before you even have the contract. Currently, DFACS already offers early intervention and homestead service contracts, which Family Menders has. That helps prevent your foster care entry. Investing in these programs are what reduces trauma and long-term DFACS spending. Providers like Family Menders already have those contracts. However, my agency has not received a single referral for prevention services since November 7th directive. I'm not sure if this is due to the report that services need to be in court orders, but prevention services are never going to be in court orders. They're not in care. And just a reminder that prevention services is cheaper than foster care. Maintaining stable DFACS funding and ease of access to services will allow the study committee to evaluate spending without limiting progress for our families or destabilizing the provider network. We are asking full funding for out-of-home care, DFACS contracts, and direct services for FY27, clear guidance to DFACS supervisors and case managers on insurance medical services versus DFACS-funded child welfare services, the department to provide training for DFACS supervisors and allow them to do those lower-level approvals for short-term services and reserving the lengthy state approval for higher intensity situations. I spoke about this in December. This sort of goes with Dr. Gibbs, but also requiring accreditation for your direct service providers. That's where you're going to make sure you're getting those evidence-based services, that you're getting your outcome scores. I didn't do quarter 4 because this all came through in November, but quarter 3 last year, measurable progress, if you worked with Family Menders, was 92.42% of having measurable progress. The burden currently placed on DFACS staff and foster parents is just not sustainable. We've already heard numerous times of the reduction of foster homes across the state over the last few years, and I fear we will have an even larger decrease as foster parents do not feel supported with the services they need for the children in their home. Together, Georgia supports the 2027 DFACS budget because sustainable funding, clear authorization process, and strategic prevention investments protect both fiscal responsibility and our children's safety. We're asking for your quick and caring response and want to thank you for your leadership and commitment to Georgia families. Any questions? I know that was a lot.
Any questions? We probably have a lot of them, but we might decide to talk to you about them offline.
Okay.
That be okay?
Yes.
I'm sorry for all you're going through. We do appreciate your perseverance and your candid reporting for us.
And I do, I guess it's not in here, but just to add, we're very thankful. We know that you guys have asked for the full budget. As a provider, we just don't know what that's going to look like.
Right.
So thank you. I'm always available.
Well,
and Amber, I'll send you some stuff too.
Yeah, do. And Amber will help us connect with you. We might need to sit down and talk again.
Yes, ma'am.
Soon. I'm sorry that the day went on so long. I know that makes it hard for everyone. The entire committee would be very interested in what you just said and what I'm sure we're about to hear next. So, Joel Lyon, please. so Mr. Lyon said that much of what was said by Ms. Kluger was also what he would have been presenting too. So we will get their comments together and look at them as the committee ponders what we can do next. Becky Davenport.
Oh, my word. Thank y'all so much for hanging in here, and just appreciate you so much, Chair Lady Dempsey, Representative Mathiak, Amber. We are so thankful to be here. My name is Becky Davenport, and I'm the president and CEO of Bloom, which is a nationally accredited A-plus rated nonprofit organization that has been taking care of foster children for almost 40 years. As a licensed foster care provider, we work alongside foster parents every day, and we know the value, how important it is, practical supports are to foster families who are trying to create a stable home for these kids placed into their care. But before I begin, I wanted to first sincerely thank you for the one-time appropriation in this fiscal year's budget of $300,000 for clothing and supplies for foster children, split between Bloom and another very worthy organization called the Kids Cup Closet in Dublin, Georgia. I'm here today to provide a quick update on how Bloom is able to multiply the state funding by leveraging corporate partnerships and in turn make a significant impact on foster children statewide. I'm also here to ask for a continuation of the funding. I do want to take just a quick second to refresh your memory about our flagship program, the Bloom Closet. The Bloom Closet provides a dignified boutique-style shopping experience where foster children receive a week's worth of high-quality clothing, shoes, school supplies, toiletries, diapers, and daily essentials, all completely free of charge. We operate 2 store locations, one just south of Atlanta and one in Rome. Our Bloom Closet Express truck is a mobilized store on wheels and crisscrosses the state to provide a mobile shopping experience. Bloom Direct is also our latest project, where we are actually shipping boxes of clothing to children across the state within 48 hours of placement into their foster home. Just to give you an idea of the scope of what we are doing, over the past 15 years, the Bloom Closet has distributed more than $15 million in clothing and essentials to Georgia's foster children. Last year alone, we served 8,000 foster children from 142 counties, and we gave away $2.4 million worth of free clothing and supplies. Every month, we receive calls from foster care organizations across our state and also across the country that are asking to tour our facilities, share what our processes are, and have had calls just to, would we open up a location in their area. So we're able to have this large footprint because we have worked very diligently to identify and cultivate strong corporate partnerships. Chick-fil-A, Bomba Socks, Mattress Firm, Carter's Children's Wear, they all allow us to multiply every state dollar. Today, we respectfully request that the full $300,000 be allocated directly to the Bloom Closet and that this funding be established as a recurring line item in the state budget so that we can continue to operate this innovative and far-reaching program. We have a proven track record of success, leverage, efficiency, accountability, and we are good stewards of your investment. We're not asking the state to carry this program. We are simply asking you to continue what was started this past year. For every $75 invested, a child receives $300 in daily living essentials. This is a 300% rate of return on your investment. And I just wanted to very quickly introduce Madison McDaniel and let Madison come up here. She's going to be very brief and just tell you a couple of stories about some of those Bloom Direct boxes that are going out to kids. Madison is the manager of our Express and Direct program.
Hello, my name's Madison, as Becky said. Thank you for your time. I know it's been a long day. But as she said, I manage our Bloom Closet Express and Bloom Direct program. Both programs were created with one mission: to ensure that children in foster care feel seen, valued, and deeply cared for. The Bloom Closet Express is our mobile pop-up boutique that travels across Georgia to group homes and to rural, underserved communities where foster children can shop for clothing, shoes, and other essentials. Bloom Direct is different but equally intentional. Bloom Direct provides curated, personalized boxes to children entering foster care. These are not generic donation boxes. Personalization is the foundation of our model. Foster parents or caseworkers are able to complete a detailed style quiz so we can understand who the child is, not just what size they wear. We ask about their favorite colors, style preferences, and practical needs. Each box includes clothing, shoes, pajamas, toiletries, a backpack full of school supplies, and comfort items. There is intentionality behind every detail of each box, even down to the child's name printed on the inside, to show them that someone carefully thought of them when packing it. When a child arrives into a home in a strange environment with unfamiliar faces, we want to provide a little piece of comfort. In a system where so much feels so uncertain and out of their control, that level of personalization communicates something powerful. You're not just a case number, you're not lost in the system, you're seen. Recently, I received a phone call about a 13-year-old girl who entered foster care with nothing but the clothing on her back. What she thought would be a regular day at school ended with her being transported to a new home, separated from her siblings, with no belongings, no suitcase, nothing that felt like hers. When her Bloom Direct box arrived within just 24 hours of her arriving into her new home, it wasn't filled with random items. It was filled with pieces chosen specifically for her, colors she loved, and clothing that matched her personality. Her foster parents shared this: "Mariah absolutely loved everything, and we are so beyond grateful. The sticker with her name inside the box made her feel so seen and loved. That small detail meant the world to her. She was so excited, and her smile was noticeably brighter the next morning when she headed to school in her new clothes and shoes from Bloom. This is why we do what we do. Something as simple as receiving clothing that reflects who a child is restores a small but meaningful sense of identity. Every day, I'm inspired by stories from caseworkers and foster parents across the state about the joy that these boxes bring to children in our foster care system, and we are thrilled to continue expanding and making an even greater impact across the state." Thank you for your time.
We do love Bloom. Thank you. And thank y'all just for hanging in here with us and sharing, just reminding us, making sure we've got your name right up here when we go into thinking. Appreciate it so much. Next is Michael Leverett. Appreciate it. I did that, not you. I did that. I'm sorry.
It was me this time. My name is Michael Leverett. I'm the Executive Director of Disability Connections. We're the Middle Georgia Center for Independent Living in Macon, Georgia. We're at our 30th anniversary this year, by the way. So I want to also introduce Becky Tuttle, who is here. She is actually the new Silk Director, replacing Shelley, who we miss dearly. And Kim Gibson is the Executive Director of Disability Link here in Metro Atlanta. So I'm representing all the centers for independent living. Just want to share with you thank you, as well as a little story to share with you and why we're here and why we're making the request that we are. serving and supporting constituents with disabilities as you all have and continue to do. It is greatly appreciated. And it's a significant honor for us to work with our peers with disabilities, especially from the perspective of running our centers by a majority of people with disabilities, and our board of directors are made up of people with disabilities. So we're very unique in that way. It's a privilege. By providing independent living services, we assist each individual in achieving their goals of independent living, institutional prevention, helping those getting out of institutions like nursing homes, helping youth to find their way out of after high school, home accessibility modifications, assistive technology support, building self-determination and self-advocacy, and supporting integration and participation in a more accessible community. And I'm sorry I'm reading this. It's been a long day, and I said I best stick to my script. So you have shown your commitment to support the Independent Living Network. We thank you specifically for supporting the expansion of the Independent Living Network as we are striving to cover every county in the state with independent living services. Our efforts have been jeopardized and adversely affected when our state-designated entity, who has narrow priorities versus our methodology in the IL network of serving consumers more holistically, funding was pulled, promises made of other opportunities, and after emails, questions, and calls, we have been met with 5 months of silence and unresponsiveness. The network was deeply cut, and you have those figures in front of you. This happened on September 19, 2025, during a Teams meeting and presented with a spreadsheet you have before you. Georgia's 9 centers for independent living were notified by Georgia Vocational Rehabilitation Agency of an immediate and deep reduction of funds. It was a deep cut. This sudden reduction, announced 8 days before the contract start date, has created a crisis of independent living services across Georgia, forcing operational and personnel adjustments that directly harm Georgians with disabilities. A few examples were we had to let go of 3 staff at our center. Another center left 5 positions unfilled. Another center reduced their work week hours. Another center the whole thing created a workforce instability. And it also created for all the centers reduction of services that we could provide. We need your support from the state of Georgia to support the momentum that we have been gaining together, and I greatly appreciate what we've accomplished together in a holistic nature of supporting and working with individuals to meet their needs, support individual ambitions, design effective, achievable goals together, and embracing opportunities together as people with disabilities to make our communities more inviting and accessible. We're not asking for your pity in this situation at all, but your continued partnership in keeping the momentum going so we can effectively serve Georgians with disabilities throughout the whole state. So that's why we're here. So any questions?
Thank you so much, and I know the vital work that y'all do. In Rome, I have one of the centers right up the street from my home, actually. We will take a look at it and see what we can do. Chairman Mathiak, do you have any questions at all for them? No, we know. We know, and we thank you for updating us on that and helping us try to understand the cuts and see what we can do.
I appreciate it. Thank you. Yeah. Thank you for all that you've done.
Oh, thank y'all. Thank y'all. And I'm sorry you had such a long day, but know that your message mattered, okay? Yeah. It's good that we've got this.
Did I miss anything, y'all?
I just want to... I'm Kim Gibson, and I just want to say, again, thank you for all the support, just like Michael said. But we sat here and we listened to a lot of people with disabilities that was saying, they didn't have anywhere to go for independent living and how those things were in jeopardy. And we, as Centers for Independent Living, teach those skills for individuals to be able to live in the community of their choice. They're not special needs, because it's basic needs. We're about that, we're not asking or doing anything special. We're just creating opportunities for individuals to learn those skills themselves, non-residential and peer supported. Myself, I'm deaf and I have a service dog and all kinds of things. And without supports that I received, learning how to advocate for myself, I wouldn't be standing here with a doctorate degree. So it matters. It really matters. And I think
we
that...
have to call her Dr. Kim.
And even with the, listening to the families who didn't know where to go or the supports they didn't have, Centers for Independent Living provide that support and those training and that skills so that there is that gap taken away where people can learn, and we kind of, I say it like this, we work ourselves out of a job because we're trying to teach those skills so that individuals can thrive in their own communities. That's all I had to add. Thanks.
Thank you so much. Thank you. Stan Jones. Welcome, Stan. Remember the patience that's required here always. We've missed you.
Well, everyone in this room, of course, knows how vital y'all are to all these causes, and you have, the most compelling people to help, and you do that. I'm here today for John McCain from Easter Seals of South Georgia. You've helped us with family supports before. The group would like to make a request for $400,000 to be added to the family supports budget. I know you've heard over and over again how much the nonprofits are suffering from increased costs. In Easter Seals of South Georgia case, we're the largest provider of family supports, 61 counties, 1,100 people a year roughly, and our costs are in excess of 15% over our revenue from DBHTD. So thank you for helping us many, many times, and all the people in this room who we've all been involved with for a long time, of course. And I will get to Amber a more detailed explanation. But we need some more help. Thank you.
You know what, that would be great if you could get us, just a short, brief statement, letter, quick to us requesting that. Just
yes.
If you get it right away to us, okay? Maybe by the end of the week would be great.
Yeah, I can do it. Thank you.
That'd be wonderful.
I think I heard you.
Thank you. Okay, Dr. Brittany McLemore from Vocal Point. Yes. Oh, y'all have been so patient sitting there, and you've been smiling the whole time.
Good evening. Thank you for being here today, Committee Chair Dempsey, and everyone else who have been spending so much time here waiting and listening to everyone. All of our concerns and requests are, equally important. So I just thank you all for taking the time out as well. So my name is Brittany McLemore. I am the Executive Director with Vocal Point, formerly the Georgia Radio Reading Service. I believe the last time we spoke, it was the Georgia Radio Reading Service. So we have rebranded over this past year, about 9 months ago. We chose a new name. Vocal Point is a play on focal point being the central access of information for individuals who are blind, have low vision, or live with print-related disabilities. So our mission is to empower and enrich the lives of Georgians who are blind, low vision, or live with print-related disabilities. And print-related disabilities, it's a broad spectrum, so that includes individuals who may live with dyslexia, they might have suffered a traumatic brain injury or stroke, and they're unable to read printed word traditionally, how we would access it. So we provide 24/7 audio broadcasts of printed material on air and on demand. So this includes books, magazines, newspapers, and other publications. We pride ourselves on human voice. We have over 320 volunteers statewide and beyond, actually, and we have some abroad as well, dedicated to bringing programming to our listeners We've been partnering with other organizations throughout the state of Georgia to ensure that we expand our reach. Our goal is to assist other organizations who also serve the same population to make sure that we share our resources, they share their resources with us, and we are able to bring that to the individuals that we serve and make sure that information is accessible. For example, we have recently been partnering with GVRA, and we have been producing Braille versions of their manuals as well as audio versions of their manuals as well. So our goal is to continue to expand with other organizations so that we can do the same. Many individuals who are here today have limited access to printed words, so we want to make sure we are reaching them and that we are a vital resource for them. Nearly 90% of our budget goes back into program and services. So there are currently over 250,000 Georgians who are blind, and that number is said to grow to 300,000 by 2030. Last fiscal year, we actually served 15,000 Georgians who were blind, low vision, or otherwise print impaired, but obviously we would love to increase that number. So keep in mind, this is not including the individuals who have low vision or are print impaired. That number is solely individuals who are blind. So imagine that number increase likely by 3 or more. Our expansion looks like book clubs, other community events, and actually a peer mentorship program for individuals who are blind or newly blind, navigating life after diagnosis, being paired with an individual who is seasoned, for lack of better words, and they're able to provide that day-to-day, camaraderie, getting people out into the community, because a lot of individuals who are newly blind or get a new diagnosis, they tend to isolate themselves, and they feel that, life is unfortunately over. But we have been able to provide a platform for these individuals to be able to share their stories and be able to open up about that and feel like they are part of the community. So historically, we have provided this service, but now with this rebrand and where we're trying to go and expand, we really want to provide community for the individuals that we serve in all of the programming. So we do want to just thank you so much for the support that you've already been giving us, that you continue to give us over and over, and just ask that you continue to support us in our growth and expansion. I don't want to take too much time, but I do want you to hear a testimonial from one of our listeners, Bridget Sutton, if I can go ahead and play this audio.
My name is Bridget Suttle. I am a peer counselor and peer leader here in the blind community. I am sight impaired with no sight in my right eye and very low and limited sight in my left eye. I'm also a below-the-knee amputee, and I walk with the use of a prosthetic limb. And my mantra is that, yes, my sight is opaque and cloudy, but my vision is crystal clear. Participating and being a part of Vocal Point has affected me in a few very positive ways. What I love about it, Vocal Point encourages me to tell my story, to have my voice heard. And at the same time, I also get to hear the experiences of others. And then I realize, wow, we're not that much different. We have a lot of the same experiences. And then it just reminds me that I get to be a part of a community that is here just for me, just for us. And so Vocal Point brings it all together, allows us to use our voices and tell our stories in a more positive and an uplifting way. Vocal Point provides a platform for voices often overlooked. It also connects people, it provides very valuable information, and it just makes accessibility a real everyday thing. Vocal Point stands out because it's personal and it's authentic. It doesn't just talk to people with accessibility needs, it actually talks with us, and it values our voice. With more funding, I'd love to see workshops, mentorships, more live events that give people with accessibility needs opportunities to learn new skills and even more chances to be heard. Supporting Vocal Point is an investment in people. It uplifts unheard voices, and it helps to build a more inclusive community for everyone. And it is because of Vocal Point that I now sit where I sit. Maybe 10, 12 years ago, I was new to sight loss.
I'll just go ahead and stop that now for the sake of time. But this is just one of very many listeners whose life has been changed due to the services that we provide. And we want to continue to do that for even more Georgians. So thank you again for your time. Thank you for having me.
Thank you for spending the afternoon with us. I hope you get home before dark. Appreciate you.
I wish I could say the same for you.
No, it's not going to happen, is it? It's not going to happen. Oh, y'all take care. Persevere. All right, next we have Elizabeth Apley. And then there's one more, y'all. I think, unless somebody didn't sign up, and it's going to tell me they need to talk.
Good evening. Thank you, Madam Chair, Chairman Mathiak. I'm here speaking on behalf of the Georgia Supportive Housing Association, the Corporation for Supportive Housing, Enterprise Community Partners, House ATL, and St. Vincent de Paul, Georgia, as well as Presbyterians for a Better Georgia. I want to thank this committee for your leadership over the years. You've heard me advocate for funding for the Georgia Housing Voucher Program year after year, and this year I'm here to support the governor's addition of $9.3 million to DBHDD for the adult mental health services at item 15.5.7. This will provide 404 new Georgia Housing Voucher Program vouchers and wraparound services. There are still an additional 137 vouchers and wraparound services that have to be provided by September of 2028 under the joint filing that was approved by the court last week. So as you know, the population served under the Olmstead Settlement Agreement for these vouchers are chronically homeless people with severe and persistent mental illness. And while the court has signed the order, it is contingent on the provision of these additional vouchers as proposed by the governor and the additional 137 that have to be funded in the future. It's critically important, and the commissioner has expressed to me, and I think to the committee, his commitment to continue to serve this population. He has recognized that housing is foundational to recovery for people with severe and persistent mental illness. It's a highly effective program. It's highly cost-effective. And just to quote a few of the data points, DCA has reported that the Department of Community Affairs has reported that supportive housing is shown to have a 96% rate for housing retention. It reduces days in emergency shelter by 256, reduces returns to shelter by 70%, reduces psychiatric hospitalizations by 61%, reduces emergency department visits by 81%, reduces jail days by 36 to 62%, with savings due to those reduced incarceration alone at $1,400 to $1,800 a person per year. DBHDD has documented that the Georgia Housing Voucher Program has reduced crisis services by 64% and increased the use of cost-effective supportive services by 78% once people are housed. So we thank you for your leadership. We hope that you will respect the governor's ad. We know from what happened in the amended budget that not everyone under the Gold Dome does. So we had to come and make the case to support you. Quite frankly, it's your diligence and compassion and leadership on this issue over the years that helped to bring us to this point of exiting the agreement, of serving more people. I can assure you there are many, many more that need your support, but we do thank you very profoundly for what you've done and hopefully will continue to do.
As you know, this entire committee has worked hard on that for all these years, and Amber certainly helps us find every penny we can build in any and everywhere. So thank you for your persistence, too. We appreciate it.
We've become friends over the
Yes.
years, and you are persistent.
That's one word for it. Thank you. I appreciate y'all.
Persistent in a good way, too. Okay, in a very positive way. Oh, Miss Katina, we are so anxious to see you. You win the Patience Award.
Well, you all do, I think. I feel like this is probably the best place you want to be. You hear all the stories that tug at all of our hearts. So I just want to say thank you to Chairperson Dempsey and Mathiak. I had to really learn how to say that name. And Amber, honestly. So I'm not going to stay before you long because you already know about citizen advocacy. I feel like I just want to leave you with the story and then do an ask and then leave. So real quick, because you already know about citizen advocacy and you know about it in a very deep way, but the story that touches my heart reminds me of just the other day. I supported the Athens Clark Citizen Advocacy Office to recruit a young man who is part of ESP to be on the board, because citizen advocacy believes that if we're providing services to people with developmental disabilities, we need that representation. And then Dr. Wolfensberger believes that people with disabilities are our unexpected teachers. And so when we had our meeting the other day, the young man who has autism, he said, when my mom dies, I want to die. And he said, because she is my lifeline, I don't have anybody else. Who else would be there for me? And so it was very important for us to bring him into citizen advocacy so that he understands that the power of citizen advocacy is one person at a time, bringing people into a larger circle. Citizen advocacy has been doing that for a very long time, and I'll give you a folder of information you can take with you. But when you think about who we are, it's just we're rooted in just simple but powerful belief that everybody matters. Every person does. They deserve to be seen and valued and protected and included. So this story, real quick, the heart of the matter, is a story about a man with a disability. His name is Almer. His citizen advocate name is Clay. And the story says Almer's bone isn't healing. The physician said to Clay, he's been in a cast and on crutches for several months since he fell down the stairs and broke his shin. Clay said, what can we do and what are his options? Well, I'm not optimistic that it will heal on its own, the doctor said. I think we'll have to amputate. Really, Clay asked, alarmed, isn't there a plan B? Almer sat on the table looking worried, listening to the conversation taking place in front of him. He understood the gravity of the situation, but sometimes had difficulty speaking. Clay helped him communicate. It's the most practical solution, the doctor explained. Really, Clay questioned him again. If you were faced with this issue, what would you do? And the doctor replied that I would try a bone graft first. So that's what they did for Almer. Clay Mobley saved Almer's leg, acting as a spokesperson during this most intense, high-stakes medical exam. It was the most important role Clay played in Almer's life, but it has not been the only way he has served as Almer's advocate. Clay has also been his financial advisor, his housing agent, and his friend. And this connection happened because of citizen advocacy asking people to do very hard things. So my ask for the committee to consider, on behalf of citizen advocacy, we do want to extend a deep thank you and gratitude for your continued support to the mission of citizen advocacy of bringing two people together. We especially want to celebrate the transformational impact when we got the budget increase from $200,000 to $400,000 in FY 2024. We did not take that investment lightly. We made promises and we kept them. With your increased support, we reinstated the Athens office. We strengthened existing offices. We stabilized leadership in the communities, and on and on. I think the most notable thing that we did was we became innovative. We developed and launched the Matchmaker Fellowship, a forward-thinking initiative designed to identify, hire, and train future matchmakers, people who are called to do this, people who are called to ask people, ordinary people, to stand beside someone who is not paid. And I just want to say real quick that the gentleman from ESP who has come on the board in Athens, you know, his mother was trying to figure out different ways to make sure her son is being taken care of, so she pays 2 people to go out with him in the community. When she gives big money, then they do lots of things. When she gives small amounts of money, they don't do very much. And so her son said, well, my mom's going to run out of money. So the beautiful thing about citizen advocacy is we invite people into freely given relationships. There's no exchange of any kind of money, but there is exchange of heart and commitment. And so we respectfully request an additional $200,000 in the FY 2027 budget allocated within the DBHDD line item for citizen advocacy as recurring support for the next 3 to 5 years. This investment will allow for us to sustain and grow matchmaking, expand advocacy into communities still without access, strengthen oversight and training to maintain high standards, and protect more Georgians with developmental disabilities through one-to-one freely given citizen advocacy relationships. And as I take my seat, I just want to say that what warms my heart is when I first started this work back in 2006, almost 20 years ago, you know, we were funded with the $200,000 and we were in 5 cities. But now as I look at the increased money has allowed us to go into places that we would usually say, well, we can't reach that far. But now, not only are we in Bibb, we're in Houston County and Baldwin, Washington and Wilkinson, Hancock, Jones, and Putnam, Twiggs, Chatham County, Clark County, Clayton, Cobb, Gwinnett, Fulton, and DeKalb. And for a long time, we were just in Fulton and DeKalb, so now we get to make a larger reach, and then maybe soon we'll be in Floyd County and Rome. Okay. So do you have any questions? Spalding and Fayette. I will add that. Yeah, we'll definitely add that. And I'll send an email to Amber, and if you think of other counties, because you know as the different testimonies came forth, I just wanted to kind of grab the moms and the ones who gave testimony and say, you know, let me help you create citizen advocacy in your community. It's not a very hard thing to do. We are connected to people that we know and trust. So who's your faith community? Who's your civic community? Who's in your Rotary clubs? Who's next door? Who's your neighbors? That's who we're asking to stand beside loved ones who have developmental disabilities and figure out how to do it together. Thank you.
Thank you. Thank you for your heart and your just your spirit. Appreciate it so much. Okay. Do y'all need to say anything? Anybody want to say anything before we go? Okay. Then this really very tender, I would say, 5-hour meeting, we will adjourn this hearing for this year. Okay. Thank y'all for hanging in with us. Appreciate it.